to order. Let me first acknowledge, wonderful to have Councillor Early here on behalf of Mayor Thompson, who can't join us today. Welcome, Councillor Early. And with that, Aretha, over to you for our protocols.
Thank you, Mr. Chair, and good morning, everyone. I'm going to provide a very shortened review of the protocols for electronic participation in this council meeting. As a result of the high COVID-19 cases, the regional chair and I will conduct and participate in this meeting remotely. The CAO and the executive leadership team will also continue to participate remotely. The recommended view to ensure a full view of the presentation slides in the stack or side-by-side view can be accessed through the layout button. This meeting will be live streamed. In order to ensure that this meeting remains accessible to the public, the meeting will be recessed for 10 minutes if the live stream is interrupted or fails. Staff will work to get the live stream up and running as soon as possible, and we will keep council advised. If you wish to speak, please raise your hand by clicking on the hand icon located to the right of your name in the participant list. Speakers will be determined based on members who have raised their hand using the hand icon. Voting for this meeting will be conducted verbally. For procedural votes that do not require a recorded vote, the chair or I will call for any objections. If you have an objection, please indicate your name and objection. If no objections are stated, the motion will be deemed to be adopted. For recorded votes, I will call upon each member and confirm the vote for each member. If you do not respond when called upon to vote, I will call your name a second time. If you do not respond to the second call, you will be recorded as abstaining from the vote, and your vote will count in the negative as a nay vote. If you're participating electronically and are leaving the meeting, please send an email to council@peelregion.ca to indicate that you're leaving the meeting. If you leave the meeting for any votes thereafter, you will be marked absent. We'll now commence the meeting with roll call. Mayor Brown?
Present.
Thank you. Councillor Carlson?
Here.
Thank you. Mayor Crombie? Mayor Crombie? Councillor Demerla? Councillor Demerla, thank you.
Yes, present.
Thank you. Good morning. Councillor Dasco?
Here. Good morning.
Thank you. Councillor Dillon? Councillor Dillon? Councillor Downey?
Present.
Thank you. Councillor Fonseca?
Here.
Thank you. Councillor Fortini?
Yes, I'm here. Good morning, everyone.
Thank you. Councillor Groves?
Present.
Thank you. Councillor Innes?
Present. Happy Thursday.
Thank you. Councillor Kovac?
I'm here. Good morning.
Thank you. Councillor Mahoney?
Good morning. Present.
Thank you. Councillor McFadden? I see you, Councillor McFadden. Thank you.
Good morning, everyone. I'm here.
Thank you. Councillor Medeiros?
Here.
Thank you. Councillor Paleshi?
Good morning. Present.
Thank you. Councillor Parrish?
Good morning.
Thank you. Councillor Raz?
Present.
Thank you. Councillor Sato?
Here.
Thank you. Councillor Santos?
Present.
Thank you. Councillor Sinclair?
Present.
Thank you. Councillor Starr?
Present.
Okay. And Councillor Early is attending for Mayor Thompson. Councillor Early?
Present.
Thank you. Councillor Vicente?
I'm here.
Thank
So it's
you.
Councillor Dillon. I'm here.
Councillor Dillon, I've got you. Thank you. I've marked you present. And that concludes the roll call. We have quorum. Back over to you, Mr. Chair. Thank you.
Madam Clerk, I'm here as well. I had trouble logging on. I was in the waiting room for a little while. It's Mayor Crombie.
All right. Thank you, Mayor
While I
Crombie.
have the floor, Mr. Chair, I want to say happy Eid Mubarak to everyone celebrating today.
Thank you. Okay, with that, we've noted everybody that is present. That brings us to our Indigenous land acknowledgement. We would like to begin by acknowledging the land on which we gathered and which the region of operates is part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous people inhabited and cared for this land. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are the direct descendants of the Mississaugas of the Credit. We are grateful to have this opportunity to work on this land, and by doing so, give our respect to its first inhabitants. Okay, are there any declarations of conflict of interest? Hearing none. Perhaps before we go on, maybe through to the CEO, Janice, I understand we've got a new member of the front line, so maybe I'll turn it over to you to welcome our newest bench player.
Oh, good morning, Mr. Chair and members of council. Yes, I am absolutely thrilled this morning to introduce your new Commissioner of Corporate Services and CFO, Gary Kent. Of course, Gary is known to many around the table, having come to us from the city of Mississauga, where Gary's worked for over 20 years, most recently in the capacity of Commissioner of Corporate Services and CFO for the city. And he's also very well known to many of the staff here at the region, having sat in on a lot of different project meetings and issue discussions over the years and attended joint meetings. So I think Gary will be able to hit the ground running on many things. I'm going to hand it over to Gary to say hello in just a moment. But before I do that, I want to also thank and acknowledge Catherine Lockyer and Julie Patini for filling in, and Catherine certainly for a very long time as acting Commissioner of Corporate Services, did a great job and has now moved back into her clerk's role. So the great thing is council gets to see Catherine on a regular basis going forward in her former capacity and now her current capacity. And of course, Julie as our acting CFO to carry us through the transition period while we were recruiting. And you'll continue to see Aretha, our deputy clerk, at the meetings. I'm really thrilled because right now we have a full permanent team at the region. You have a team of, I think, some of the most talented municipal professionals in Canada with our executive leadership team, Nancy Polsinelli, Janice Sheehy, Sean Baird, Keely Dedman, and Gary Kent. These are staff that I think will serve the region of Peel really well, and it's my absolute privilege to be able to lead them as the CFO. So I'm going to turn it over to Gary to say hello to everybody, and thank you for the opportunity to welcome him to the team.
Well, thank you, Janice, and through the chair, thanks very much to everyone for the warm welcome. And as you noted, Janice, especially Catherine and Julie, who actually started to onboard me before I actually started. So, you know, a little bit of a transition there, but they've been extremely helpful and everyone's been so welcoming. So I'm really excited to join the Peel team, and I look forward to really doing my best to help to all our communities in what are really a challenging time. I mean, the role of the public sector has never been more important, but this morning's not about a big speech from me. I'd just like to say hello, put a face and maybe an accent to a name. I've reached out already to all the members of council, and I look forward to sharing some one-on-one time with you, just to benefit from your advice and experience and insights as I take my first steps as part of the regional team. So thanks for this opportunity, and I look forward to some great work ahead. Thank you.
Gary, thank you. I don't know that I ever thought I'd use this analogy, but I got to tell you, I feel like the coach of the Toronto Maple Leafs going into the playoffs. We had a tremendous bench to start, and just look at who we recruited. I've had the privilege of working with Gary for years, and to think that we could find someone of your caliber, I'm just delighted, and you're such a welcome piece to the team that we had with Keely and the other bench strength that we have. I'm overwhelmed to think of where we are relative to a couple of years ago, the great team that we had and the new players that we brought in now. So the chair is very, very pleased, and great work to our CAO to be able to attract people of this caliber. Finally, Catherine, you distinguished yourself in the role, and dare I say you're the most valued employee to the chair, because I don't know how I'd run my office without you. So really acquitted yourself well, and that certainly won't be forgotten. Okay, with that, carrying on with the business of the day. Are there someone that'll move the approval of the minutes for me for April 22nd, Madam Clerk?
Thank you, Mr. Chair. Yep.
I see Bonnie waving her hand, and I saw Councillor McFadden as well moving the minutes.
Okay, thank you. So we've got a motion moved by Mayor Crombie, seconded by Councillor McFadden, that the minutes of the April 22nd, 2021 Regional Council meeting be approved. Are there any objections? Hearing none, that carries.
Okay, Madam Clerk, on to the approval of the agenda.
Got a motion moved by Councillor Carlson and seconded by Councillor Vicente that the item 24.3 on the May 13th, 2021 Regional Council agenda be withdrawn, and further the agenda for the May 13th, 2021 Regional Council meeting be approved as amended. Are there any objections? Hearing none, that motion also carries.
Thank you, and a shout out from the chair to all of you that it went through without an addition. So well done, the message is getting out. Okay, Madam Clerk, over to you for the consent agenda. You moved it so beautifully 2 weeks ago, and we got out 2 hours early, and it's an old sports adage, you never change a winning game. So Aretha, work us through the consent agenda.
Thank you, Mr. Chair. So we've got the delegation, and then we'll skip to Section 8, the COVID-19 related matters. Item 8.2, mass vaccination supporting the South Asian Task Force. Is there consent for this item? So it sounds like we have consent. Thank you. Moving on to communications, item 9.1, Doug Zowney, Attorney General, and Steve Clark, Minister of Municipal Affairs and Housing, letter dated May the 3rd, 2021, advising of amendments to the Liquor License Act to provide tools to municipalities to modernize the regulation of alcohol consumption. Is there consent for this item? Consent, thank you. 9.2. Communication from Christine Massey, resident, City of Toronto, email dated May the 9th, 2021, regarding declaration of Canadian Physicians for Science and Truth in relation to College of Physicians and Surgeons of Ontario threats. Is there consent for this item? Thank you. Got a staff presentation. 10.1, so we'll move to section 11, items related to planning and growth management. And the first item, 11.1, Peel's Growth Management Program and Development Charge Performance 2020 Overview and Progress Report.
Hold it.
Councillor Parrish, thank you.
Thank you.
11.2, Report of the Region of Peel Planning and Growth Management Committee for the meeting that was held on April 29, 2021. Is there consent for this item? Yes, thank you. Moving on to section 13, items related to enterprise programs and services. Item 13.1, 2020, operating financial triannual performance report year end. Is there consent for this item?
Please hold.
Is that Councillor Raz?
Yes, it is.
Thank you. 13.2, 2020 capital performance and impact on capital reserves and reserve funds. Is there consent for this item?
Hold.
Councillor Dasco, thank you. 13.3, 2021, the tax capping policy, selection of options. Is there consent for this item? Consent, thank you. 13.4, the interim delegation of procurement authority. Is there consent for this item? There's consent, thank you. 13.5, Region of Peel archives update. Is there consent for this item? Thank you. 13.6, nurse call solution replacement for Sheridan Villa Long-Term Care Center. Is there consent for this item? Thank you. 14.1, communications, Province of Ontario, Ministry of Municipal Affairs and Housing. It's an email dated April the 14th, 2021, regarding a 90-day public consultation on how to strengthen municipal codes of conduct.
Hold, please.
Yes, hold.
Councillor Rouse and Councillor Parrish, thank you. 14.2. It's a letter from Steve Clark, Minister of Municipal Affairs and Housing, the letter dated April the 27th, 2021, regarding an invitation to participate in a telephone town hall, which is related to the Municipal Code of Conduct consultation. Is there consent for this item? Councillor Parrish? Thank you. 14.3. It's a letter from Sonia Pacheco, Legislative Coordinator, City of Brampton. The letter is dated April 21st, 2021, providing a copy of the Brampton Community Safety Advisory Committee recommendation related to gangs and gun violence. Is there consent for this item? Yes, thank you. 14.4, a letter from Angela Surrey, Executive Assistant, Regional Municipality of Peel Police Services Board. It's an email dated April 26, 2021, providing a copy of the Police Services Board report titled Illicit Cannabis in Peel Region. Is there consent for this item?
Hold, please.
Councillor Raz? Thank you. Items related to Public Works, 15.1, imposing a special charge under the Municipal Act 2001 for local improvement project 152701 for St. Luke's Court, City of Brampton, Ward 10. Is there consent for this item? Yes, thank you. 15.2, it's an increase to contract 2017-395N for the biofilter media replacement at the Peel Integrated Waste Management Facility. Is there consent for this item? Yes, thank you. 15.3 is a request to amend the agreement for contingency waste disposal services with Emerald Energy from Waste Incorporated. Is there consent for this item? Yes, thank you. 15.4, the paid duty police coordination services for construction. Is there consent for this item?
Please.
Councillor Raz, thank you. 15.5, designation of the Greater Toronto Area West Transportation Corridor project under the Federal Impact Assessment process. Is there consent for this item? Thank you. 16, under communications, 16.1, Doug Ford, Premier of Ontario. It's a letter dated April the 19th, 2021, responding to a letter from the Regional Chair, Unica, regarding the GTA West Highway Corridor. Is there consent for this item? Yes, thank you. 16.2, John Floridan, resident town of Caledon. It's an email dated April 29th, 2021, opposing Highway 413 and the conversion of farmland to residential, commercial, or industrial use. Is there consent for this item? Yes, thank you. 16.3 we will have to hold. So moving to 16.4, Sean Carreri, Acting Regional Director, Ontario Regional Impact Assessment Agency of Canada. It's an email dated May the 3rd, 2021, regarding the designation request decision for the Greater Toronto Area West project under the Impact Assessment Act. Is there consent for this item? Yes, thank you. 16.5, Stephanie Smith, Legislative Coordinator, City of Mississauga. It's an email dated May the 6th, 2021, providing a copy of the City of Mississauga resolution regarding provincial action on noisemakers. Is there consent for this item? Yes, thank you. Skipping down to section 19, items related to human services. 19.1, it's a contract extension, Our Place Peel, Emergency Youth Shelter. Is there consent for this item? Yes, thank you. 19.2, the Community Investment Program 2020 Fund Update. Is there consent for this item? Yes, thank you. 19.3, supply and implementation of housing enabling technology for the region of Peel, document 2020-107P. Is there consent for this item? Yes, thank you.
Madam Clerk, with that, I know we then have communications, other business, and councillor inquiries. Did you have anything further on your list, Madam Clerk, before I go through notices of motion?
There are the in-camera matters. So
I'm going to come to them right now. So I know we have the notices of motion, we have the bylaws, and I wanted to take the in-camera in turn. Councillor Starr?
Yeah, I can't seem to get on. I wanted to hold 15.2 and 15.3, but I had a problem with the connection here. 15.2,
Okay,
15.3, can you hold those?
Absolutely. So we are going back, Madam Clerk.
Councillor Starr, 15.2 and 15.3. Thank you.
Yeah, thank you.
Very good. Let me just note Starr.
And Mr. Chair, there is nothing else other than the notices of motion and the in-camera matters.
Which I will take in turn now to see if we can deal with some of the in-camera now. The first item I have 24.1 is the minutes from the last meeting. Would I have consent on that? Hearing no one, yes. 24.2 in camera. Do I have consent on the water and sanitary sewer replacement? On consent. 24.3 has been withdrawn. 24.4, email from the Minister of Infrastructure regarding Crown Agency information. On consent, 24.5, Minister of Infrastructure, similar information regarding Crown lands. On consent, 24.6, again, Minister of Infrastructure supplied in confidence to us regarding Crown Agency items. On consent, and finally 24.7, email from the Minister of Infrastructure, again, information on Crown lands. Do I have consent? Thank you, so well done. That means we've dealt with the in-camera. Madam Clerk, there is nothing else in camera, is that correct? Aretha, I can't hear you. Oh, very good. So, Madam Clerk, then I send the bylaw over to you for the consent agenda for the vote.
Oh. Okay, thank you. I've got a motion that's moved by that the following matters listed on the May 13th, 2021 Regional Council agenda be approved under consent agenda. Brown.
Yes. Can you hear me? Yes.
And we may have a problem hearing you.
Yeah.
You're coming in and out.
Can you hear me?
Okay, yes. Can you hear me? Yes. Mayor Brown here.
We can't hear Aretha.
Aretha, if I may, here's what I'm going to do. Okay, carry on or else I'll jump in and take the rest of it. Go ahead.
Okay.
Yes.
You.
Yeah.
Mayor Crombie?
Yes. Aretha, I don't know if you know, you're coming in and out. We can't hear you very well.
Okay, I'll do what I can on my end to fix this. Let's see what I can do here. Okay, all right.
Sorry, was that Councillor Damerla that you said? I couldn't hear, but anyway, yes.
Aretha, what I think I'm going to do is I'm going to take it from here to continue calling out each member for their vote on the consent agenda. We just dealt with Councillor Damerla.
Councillor Dasko?
Councillor Dasko.
Yes.
Okay.
Thank you. Councillor Dillon.
Yes.
Okay.
Thank you. Councillor Downey.
In favor.
Thank you. Councillor Fonseca.
Yes.
Thank you. Councillor Fortini.
In favor.
Thank you. Councillor Groves.
Yes, in favor.
Thank you. Councillor Innes. Thank you. Councillor Kovac.
In favor.
Thank you. Councillor Mahoney.
Yes, in favor.
Thank you. Councillor McFadden.
In favor.
Thank you. Councillor Medeiros.
In favor.
Thank you. Councillor Paleshi. Councillor Paleshi. I will come back. Councillor Parrish.
Yes.
Thank you. Councillor Raz.
Yes.
Thank you. Councillor Sato. Thank
Yes.
you. Councillor Santos.
Yes.
Councillor Sinclair.
Yes.
Thank you. Councillor Starr.
In favor.
Councillor Early on behalf of Mayor Thompson.
In favor.
Thank you. And Councillor Vicente.
Yes, in favor.
And I go back to...
Paleshi, yes.
Very good. Madam Clerk, will that suffice? I believe the motion
I-
carries.
I just want to make sure that as Mayor Brown that you heard my yes, because I wasn't able to hear if the clerk heard it.
Mayor Brown, absolutely duly noted as well. Okay, with that, we've dealt with the consent agenda. Thank you all. That brings us to our first delegation, item 7.1, Sylvia Roberts, resident City of Brampton, regarding the Greater Toronto Area Corridor and Mayfield Road widening. Sylvia, welcome, and you have 5 minutes.
Good morning. My name is Sylvia. Can you hear me? Excellent.
Yes,
All
please
right.
proceed.
So my name is Sylvia. I am a resident of the City of Brampton. I've seen that the Region of Peel is requesting further review of the GTA West corridor, and the federal government has granted it. Next slide. The federal government has recently taken over control of the EA for the GTA West corridor, which may result in the termination of the highway component of it. This has significant implications for the Region of Peel, is in addition to being an inter-regional highway connecting York Region through Peel to Halton Region. It's also going to facilitate significant movement within the Region of Peel, east and west, providing a significant complement to Mayfield Road. The highway plan has a number of significant problems with it, such as adversely affecting a number of species on the federal endangered species list, which is part of why it's not looking so great for this highway, which I believe was what you desired. However, it was attempting to address a genuine need, the significant demand for mobility in the future. Without this highway, the region needs to review alternatives, hopefully one which is much better in terms of land use planning. The question is, where can you build a major east-west corridor in the Region of Peel without causing the same kind of adverse environmental impacts while handling significant amounts of demand, hopefully at an affordable cost? Next slide. The answer, folks, is Mayfield Road. It's currently in the works to be widened, as you can see from this regional timetable. From its existing rural two-lane side road configuration to a major transportation corridor for the Region of Peel. The fact that this chart shows construction work will not begin until 2022 offers an opportunity. The region could redo the designs to plan for rapid transit, saving a bundle of money and time in the future by not needing to relocate utilities as they're already done. So I've looked at the EAs for this. This was all planned contingent on the fact that the GTA West corridor was going to exist. And this was also before Brampton Transit had significant growth. So in many ways, it was seen as this just needed to be a massive arterial road like Steeles, plus the need for transmission corridors. With the GTA West corridor looking increasingly likely off the table, it may be a good idea to review it. The relocation of the utilities, I believe what is it, 800 millimeter mains that are going under Mayfield Road. Those are incredibly expensive and time consuming to do to relocate the utilities for 25 kilometers of it in the future. If the region plans ahead, setting aside utilities in such a way that Mayfield Road could have rapid transit on the future, it would save an enormous amount of time and money. Think of how long the Hurontario LRT has been under construction on Hurontario, and it's actually just, as far as I can tell, it's pretty much all relocating utilities at this point. It's quite expensive and time consuming. Mayfield Road is an entirely regional road and will be able to facilitate the same kind of transportation demand that was planned. The region, I believe, estimates the transportation capacity of a lane of regional road at between 600 and 700 vehicles per hour. For example, a BRT, which is basically your entry level rapid transit, can move in excess of 2,000 per hour, and a number move well in excess of 3,000. So you would give up 2 lanes potentially for cars, but gain the capacity equivalent of 6 lanes. So it'd still be a 5 or 6 lane road, but you'd be able to move the equivalent of the Gardner Expressway in people, but without the environmental consequences. So it would probably be in the region's best interest to review Mayfield Road and where it wants to go in the future. Additionally, planning transit in the future on Mayfield Road will help influence the pattern of development that the developers will bring forward, away from sprawl and towards a more compact transit-oriented development form. Thank you. That's my delegation.
And right on 5 minutes, Sylvia. Thank you. Are there any questions? Hearing none, it's my understanding, and Sylvia, thank you for your...
Hand raised.
Oh, I'm sorry, Deepika, I missed you. Councillor DeMerla, please go ahead.
Thank you. I just wanted to thank the deputant and just say I think it's an interesting idea, and I just wanted to hear if staff had any comments. Is it something that we're already looking at, perhaps, or?
And DeMerla, what we were planning on doing, with thanks to Sylvia, I understand it's already in the works that the matter is being referred in the delegate to staff, and a meeting is being scheduled, and I would expect staff to be coming back with a report.
Okay, thank you.
Thank you. Are there any other questions? If none, Madam Clerk, over to you for a receipt of the delegation. I don't know if you require a vote.
We don't require, just if you can see if there's any objections, we just need a mover and a seconder for receipt of the delegation.
Councillor DeMerla, seconded by Councillor Starr. Any objections? If not, that carries. Sylvia, thank you for your time and more work to be done. Okay, that brings us to item 8, COVID-19 related matters. Update on Region of Peel's response to COVID-19. Our presentation from Dr. Lawrence Lowe. Dr. Lawrence Lowe.
Thank you, Chair Yanika, and good morning, members of Regional Council. It is a presentation, as has been done over the last few weeks, with Dr. Lawrence Lowe and team. So Manali Varia and Brian Laundrie are joining me to present. And we will basically review the current COVID-19 situation and public health measures, as well as our ongoing mass vaccination effort. There are some important messages here, specifically regarding the start of changing COVID-19 trends in terms of our case numbers. However, our ongoing issues with hospital capacity challenges and a lack of confirmed stabilization in that picture, as well as our increased vaccination capacity and coverage, made possible thanks to the increased provincial allocations that we've received, getting to, at this point, having vaccinated 50% of our adult population and moving quickly to vaccinate over 1% a day. I'm hoping that the message out of our presentation today is that we still need to stay the course, to be cautious, and to continue with the public health measures as our cases remain high and the escape valve, which is our hospitals that have wards and ICUs, are still unfortunately unable to accommodate more. So really the whole cascade of cases into hospitalizations into ICU is something that we're particularly concerned about with the variants of concern, and we would lose momentum if we were to relax measures too quickly. It will also ensuring that we basically maintain measures in some form or another is going to be critical to making sure that we get forward, that we are also able to give our vaccines program time to actually change the course and the tail of the tape in our community. So we'll go to the next slide, please. So this is our agenda. We will start with Manali providing an update on our COVID-19 situation and our perspective on measures, and then on with Brian Laundrie as to an update as to our rapidly increasing vaccine coverage and our community mass vaccination update. And then I will close with some of our next priorities between now and our next presentation to Council. So with that, I will pass it over to Manali to start on the next slide. Thanks, Manali.
Thank you, Dr. Lowe, and good morning, Chair Anika and Council. So before Brian speaks to the progress on our vaccination program, I'll just share the current picture of COVID-19 in Peel. So we'll start again with COVID-19 incidents across Peel, and this is the slide that shows the rate of new cases by week for Peel as a whole in the thicker black line. And just a reminder that those threshold rates under the provincial reopening framework are shown in the colored horizontal lines, which you can see that we are above. So we are about 5.5 weeks out from the April 3rd shutdown and 5 weeks out since we switched to remote learning on April 6th. And we are now seeing, as you can see, some improvement and a little bit of that light ahead resulting from public health restrictions that we have been under just in light of the variants of concern. So our current weekly rate, which you can see from the graph, is just under 300 per 100,000 population. And visually, you can see that this is higher than our January wave 2 peak, but the trends are downwards, so in the right direction. Just some additional information, our current 7-day moving average is 650 cases, and we have seen over the past few days a continued 2 to 3% daily decline in cases. Our reproductive number for Peel is less than 1 for all municipalities, which essentially means that each case is infecting less than one other person. Next slide. So the incidence rates are decreasing across most age groups, and all age groups have declined from their peak levels. What I just wanted to note here is that the 80-plus age group that was among the highest incidence group is now the lowest incidence, which is a positive outcome of the vaccination program to date. Next slide. So as Dr. Lowe mentioned, while the case numbers start to come down, hospitalizations continue to be a lagging indicator just because of the nature of disease progression. And so we continue to see pressures faced by the health system in Peel, as well as across Ontario with the hospital's transfers still occurring. We've previously shared with Council total occupancy, which looks more flat because those hospital transfers are occurring. This week, we're just showing in the top graph new COVID-19 hospital admissions in Peel over time. And then the bottom graph shows new critical care admissions. And just noting on the right-hand side of the graph, both of these show just the continued daily burden. And then just to show that last week there were 146 new hospitalizations to Peel hospitals compared to 153 the previous week. Next slide. So we've seen the effect of variants of concern in Peel. They've led to the rapidly increasing case volumes as well as increased severity. In this figure, we looked at Peel COVID-19 cases that were hospitalized from January 31st through to April 17th. And what we wanted to show here is that across all age groups, a larger proportion of COVID-19 variant cases, so these are the darker blue dots, required hospitalization compared to non-variant cases, which is the lighter blue dots. You can see that the greatest difference is in the older age groups, and this is one of the key reasons why an age-based approach to vaccination had been important to date. Next slide. So the current situation just describes the need for those continuing public health measures, as mentioned by Dr. Lowe. We expect that the provincial stay-at-home orders, which are currently listed to expire May 19th, will be extended, which will be important for Peel as our current rates remain high, and as seen in that graph, exceeding those that the rates that when we entered the current measures. So while we're waiting for the provincial direction, the Peel Section 22 workplace order and those workplace dismissals will continue post May 19th. And we are still having ongoing discussions with the province. So that includes regarding school reopening, as well with the Ministry of Education and our school boards, around what is being considered as part of the decision in light of our COVID-19 rates, as well as the increased vaccination uptake. We are also advocating for updates to the provincial framework with measures based on our new knowledge of variants of concern as well as immunization rates. So that includes provincial adoption of measures that are both relevant to levels of community transmission, such as our workplace dismissals, or updated guidance around masking. We're also trying to understand the provincial plan around what modified measures will look like based on levels of vaccination in the community. So the previous provincial framework did not have that included. So overall, we trust that these measures will continue to help us turn the curve in Peel and allow vaccination to prevent any subsequent waves. So I will turn it over to Brian now just to provide an update about Peel's community mass vaccination plan.
Chair, I'm just checking to see if Brian Laundrie is in the room.
Brian, you're up. Can you hear us? Dr. Lowe, in the absence temporarily of Brian, did you want to carry on with your presentation and then we'll double back?
Yeah, I was going to suggest that, and it sounds like Brian just texted me and says that he is here. So why don't we go to the next slide and I'll get started. And in the event that he joins, then we can I can pass the baton over to him.
Thank you.
So thank you, Manali, for the perspective on the number of on our situation. One of the things that does give me a certain cautious optimism is the significant accomplishments and success of our COVID-19 vaccine program to date. And actually, it's a good thing that I'm doing this slide now because you know, I can actually thank Brian and the entire team and who have been working tirelessly on this with you know, certainly an evolving situation and really have worked you know, tirelessly to deliver as much vaccine as possible to meet the needs of our community while also ensuring that no one is left behind. So some of the most recent updates we'd like to share with you are listed on this slide. We have surpassed 700,000 doses delivered, administered 716,000 doses as of the 11th of May. This is over, and of these 700,000 are first doses. As I mentioned in the offset, 50% of our adult population over 18 plus have been confirmed to receive their first dose. We passed this milestone earlier this week. And based on last week's average, we are currently vaccinating around 125,000 residents every 7 days, aiming for 150,000 residents this week. And last week, we had updated our eligibility criteria to include all Peel residents aged 18 and older once the province had moved to open hotspots 18 and older and really unlocked vaccination for 85% of our community. We also continue to use community clinics in a considered approach. This is really about trying to get to our hardest to reach populations that cannot attend at a mass vaccination clinic. And there are 30 community clinics that are completed and planned, getting to priority populations such as workplaces and various communities within Peels. These are meant as a complement to our mass vaccination clinics to address barriers that that certain communities and individuals within our community might have in actually accessing vaccination through other means. And as an example of outreach and communication strategies, we are very excited to be hosting a Doses After Dark, a flash vaccination marathon event to deliver over 7,600 vaccine doses in a span of 32 hours from Saturday afternoon until Sunday evening this weekend. The aim is to try to get 5,000 during the overnight hours to test the interest in overnight availability. And this event has drawn a lot of attention and media interest. The initial focus certainly is on getting Peel residents into these clinics as much as possible, as well as supporting those who work in Peel and who may be either at risk of transmitting or acquiring the disease in our community and therefore passing it on. To date, we've seen that the appointments are strongest in the daytime, evening, and morning hours. And we are seeing that the appointments are not necessarily being taken up as much in the overnight hours. So I would encourage council to promote to all your channels. There are a lot of appointments available throughout the overnight hours of the Doses After Dark event. We really encourage our residents to take the opportunity to access their first vaccine, and there will be lots of fun. I know I myself will be there vaccinating for a good part of the overnight section. And we have put considerable effort into promoting this clinic. We've reached out to over 50 or 60 different employers, I believe, pushed out through various different community channels, and are continuing to increase uptake and work with community agencies to try to get our most vulnerable, as well as our shift workers who we're testing this for to some extent, to get them into this clinic. And then we will take our lessons learned in terms of what it looks like in the final format around interest in overnight hours, late evening, and early morning hours, just to inform our ongoing planning going forward. So it's an exciting community initiative and activity, and it is also a good opportunity for us to pilot whether there is an interest in service offerings at different hours throughout the day. So, Brian, I believe you may have joined now. So what I will do is I will pass it over to you to take us through the details of coverage and the plans for the upcoming weeks. So take it away, please.
I'm not sure I am here, Lawrence. Can you hear me?
We can hear you.
You're good to go, Brian. Go ahead.
Okay, sorry. My slides are really lagging, so I'm not sure that I even have the notes, but could we go to the next slide, please? So, excuse me, this is a slide of the first dose coverage for by age group across each of our 5-year age groups. You can see it goes from descending order from the 80 plus at the top down to the 18 to 24 age group at the bottom. And the note on the right shows that as of May 11th, so a couple of days ago, 71% of the residents 50 plus have received at least one dose, which is really an encouraging statistic. And certainly those over the age of 60 have always been identified as the most at risk for disease and severe illness and death. So it's great to get to some of those high numbers of the 75 plus in those age groups. The 68% and the 80 plus is a bit of a variable statistic. It's a little dependent on the denominator, which is difficult to estimate at any given time because it changes frequently. We've used the registry, the registry for this denominator, and other denominators have shown that population at a higher percentage, but we continue to work at that population with their mobile clinics or et cetera, to increase that percentage. As we move down into the 45 to 49, in the lower age groups, you can see the uptake is less because they've been eligible for a shorter period of time. Our best clinics will see the majority of uptake in these age groups over the next short while, and we look forward to increasing those percentages. It's also important to note that those older age groups continue to increase, even around the 1% per week level. So there's good uptake, and it's good to see that those older age groups are continuing to increase. Next slide, please. This is a slide that shows our total system capacity across Peel. So I'll just work through it from the bottom to the top. The green bars at the bottom are the hospital fixed clinic sites, and the time period for this bar chart is from beginning of last week, so May 3rd to the end of next week, so May 23rd. And so we're right in the middle of this bar chart as we speak. You can see the hospital capacity just at the start of May was in the 62 to 6,500 range. They've increased their capacity and continue to hold that steady capacity throughout the end of the next week. As we look further up the charts, the mid blue color is the pharmacy channel. As we know, we had a pharmacy pilot that rolled out in April, and we had up to 151 pharmacies delivering AstraZeneca. And of course, with the AstraZeneca availability, first of all, and then the pause on the use of the AstraZeneca by the province, that channel halted. But we've supplemented pharmacies last week and into this week with our own supply of Pfizer in a continued pilot of using Pfizer in pharmacies, and you can see that channel is ramping up fairly quickly. We're working with our provincial partners to determine what the long-term sustainability is and what the model will look like, because the province has dealt directly with pharmacies on that channel. And that implemented last weekend and continues to grow throughout this week. The orange bars are the primary care channel. Again, we had a pilot with, we had 30 primary care sites. With AstraZeneca, we've switched that over to 6 hubs that have Pfizer and 24 mobile sites that are utilizing Moderna. Or not, sorry, mobile sites, 24 other sites, primary care sites that are utilizing Moderna. And that uptake is started. The early indications, it's just been a day or two, is that the demand is fairly robust in the sites that have been able to start. And for those 2 channels, the pharmacy, we're looking at probably about a 20,000 per week uptake in the first couple of weeks, and for primary care, maybe in the 12 to 13,000 vaccinations per week range. And those 2 streams, just for interest, are really going to be our longer term strategies, where people in the community will be able to get their vaccination from those trusted healthcare providers and with the convenience of their local neighborhoods. Yellow bars are mobile clinics, and included in here are workplaces, our community pop-ups, the both ministry sponsored and run, and those run by the region, and those sponsored by workplaces. They're a little bit more variable, but they've kind of smoothed out over the three week period here. So we've got a number, and we'll go into a little bit more detail on this, but all those different types of community pop-ups, sometimes difficult to keep them straight in terms of the numbers. And then as we get to the top of the to the dark blue bars, that's the fixed clinics that we run at the region. And there's a fairly substantial growth in our fixed clinic capacity from the beginning of May, where we were at around the 8,000 a day capability to the end of the 3 week period, where we will be in fact over 20,000 fixed clinic capacity just with the regional clinics. Next slide, please. So this is focusing now just on that mobile piece, and again, it is a little complicated, but I will walk through it a little bit. And you can see that overall the doses within this strategy aren't at the same level as it would be through the fixed clinics. But in our congregate settings, our mobile teams have done 160 clinics with about 22,000 doses since the vaccination program began. Moving to the right on the in-home, we've vaccinated over 400 in-home residents and expanding that to be able to more rapidly get to those home clients. It's a very time-intensive and very personal service, but very important for that vulnerable population. And we move into the community settings, where we have underway or planned or completed 10 clinics just run by our mobile team in collaboration with community partners, where we're targeting to do about 5,000 to 6,000 vaccinations within the month of May. As we look down to the bottom lower, we have the workplace clinics, where there's 5,700 doses have been completed with our 3 first workplaces of Maple Leaf, Maple Lodge, and Amazon. And those are almost complete. We have 12 other employers either underway or in the planning committed stage to be opened up over the next few weeks and completed, starting to get a little bit, well, not necessarily smaller numbers, but a target maybe of there's 32,000 workers in those workplaces, but maybe if we looked at a 15 to 17,000 vaccination uptake, depending on how many of those employees are going to take advantage of other vaccination opportunities or already have. Moving into the blue boxes for our community clinics, we have those sponsored by workplaces and those sponsored by the ministry on the right. So we have two planned or underway for 4,200 doses starting this weekend. And then on the right, the community pop-ups at the ministry where we are underway with 6 planned or underway with a target of 22,000 doses. So a very broad-based approach in our mobile clinics, and an approach that I think will be targeted at the more those that have barriers to access and those who are the most in need in our community. Next slide, please. So this slide is just before I wrap up, the focusing again on vaccine acceptance. So we're feeling confident in the efficacy and efficiency of our mass clinics and of our mobile response, but we continue to work with our community partners because we know that there is variability in interest and confidence in vaccine acceptance. So the picture shows you the continuum of that vaccine acceptance from those who will totally refuse to those who are all in early. And accept everything. So the place we need to focus is in what is referred to here as the movable middle. So trying to move those who are unsure that we could right now, no, but maybe we could move to a yes, and to continue to support those who are still in the middle. What we've seen in our work so far is in the blue box in terms of the themes around convenience, communication, and access. Also, there's a cultural context and there's a whole confidence piece that we're seeing, and there's lots of descriptor under each of those categories about what they mean. But what we're doing to address it is sort of a multi-strategy approach where we have, where you can see on the slide, leveraging our social influencers and group norming and forming those communities within communities, offering safe and trusted places that are often familiar or in local areas that people are used to going to, increasing outreach efforts through trusted advisors, community ambassadors, local faces, making vaccination easy. So this is where the access and the hours and the transportation options and all those things that we work on behind the scenes come into play. And then debunking the myths and misinformation. And there's still some of that out there. And that's a never-ending, I think, never-ending challenge, and one that was going to survive not only the first vaccinations, but for those who received their first dose, but the need to continue it for those to receive their second dose. So I think that's my last slide, and thank you, and I'll just pass it back to you, Dr. Low, and thanks for covering that first slide with the IT mix-up.
No problem. Thank you, Brian. So if we'll go to the final slide, please, which I believe is just in respect to priorities. I just want to conclude by highlighting our immediate priorities. So first of all, we do continue to require a stable and sufficient vaccine supply. As described by Brian, our system capacity has ramped up and continues to deliver significant doses. Without a continuation or stabilization of our supply, ourselves and our hospital partners will need to start reducing capacity again as early as May 21st, just ahead of the Victoria Day long weekend, as we're anticipated to have gone through our entire allocation by that point in time. We are also already working with our hospital partners to maximize the existing allocation, with significant capacity coming online both this week, which is our biggest week yet, and then into next. Certainly the pressure for more allocation will be compounded by expansions in eligibility anticipated in the next few weeks. So we do know that the province is actively discussing vaccination of the population 12 to 17-year-old, which will hopefully, and which I understand that they're hoping to do prior to the next school year. and also the administration of second doses, which we are still awaiting guidance on as to whether the 4-month window will be maintained or what that will look like, and also with the expansion of second doses now to highest risk healthcare workers as well as urban indigenous, and waiting for details on that. So that will increase the pressure for a need for a stable and sufficient supply. In terms of reaching our expected 75 first dose coverage by the end of May, we also really need the community's help. We will continue to maintain our mass clinic capacity. We really do encourage you to help us in reaching out to the community for those who haven't received their first dose yet, to ensure that they avail themselves of all the offerings and the significant allocation capacity that has been provided. While we also increase our focus on the hardest to reach residents and those with lower vaccine confidence to increase their confidence and move to vaccination. So really it is about continuing to maintain our significant throughput in mass clinics, and then also working on those harder to reach residents, both getting to them should they face significant barriers in accessing mass clinics, and also supporting them to attend at a mass clinic by getting arms to needles, as we have been doing throughout the course of this this campaign. And finally, in addition to vaccination, it is vital that we continue our existing public health measures. I think the data shown by Manali are very clear. Our current number of cases still remains unsustainably high, and continue to drive a cascade into hospitalizations and ICUs, and a system that continues to face challenges and is transferring patients all over Ontario. The combination of sustained public health measures and our rapidly growing vaccination efforts, our continuously growing vaccination efforts, is needed to avoid a future wave, and allow us to start to reopen, hopefully gradually with confidence, once we get to 75 first dose coverage as a first milestone, moving to a combination of a 75% first dose coverage and a 20% second dose coverage in short order, and then hopefully trying to get to 75% two-dose coverage, which is really where we will see significant changes in our patterns. But at least even getting to 75% first dose coverage, international experience indicates that that is where you start to really resolve a lot of the transmission and hospitalization patterns in communities, and permit at least a modest reopening of the economy and society in short order. So I think we continue to push towards that goal, but also still need to have the immediate measures in place to reduce contact and interactions so that we can address and resolve the immediate wave that we continue to exit from. So with that, I will thank you, Chair and Council, and myself, Manali, and Brian are happy to answer any questions that you may have.
Thank you, and I have several. My list of questioners at this time is Damerla, Brown, Sato, Kovac, Dasco, Crombie, Paleschi, and Groves. And many of you have spoken to me about this, and I've confirmed with the clerk. I remind you, we at this moment are only asking questions, a maximum of 2, a maximum of 5 minutes in total, because I remind you, as the clerk pointed out, I don't have a motion before me, so we're not debating any matter unless someone wants to make a motion. So to keep us moving along, I go to my list, maximum of 2 direct questions to staff for a total of 5 minutes. Councillor Damerla to kick us off.
Thank you, Chair. And I want to begin by actually congratulating Dr. Low and his team on hitting a milestone, 50%, and some really innovative pieces around doses after dark. I do have a number of questions, but I guess I have to limit them to 2. So I will ask you these 2. The first one is, you hinted at, Dr. Low, starting to think about the second dose, and I wanted to know, once we hit the 75% at the end of May, will we consider doing something along the lines of, if enough of the appointments aren't filled by the end of the day, that maybe the second dose folks can start to come in and move their appointments forward? Would that be something that would help us from a epidemiology epidemiology point of view to start filling in those second doses if there aren't enough people taking up the first dose, given how big our capacity is now to vaccinate. And then my second question was I just wanted to flag for you that I had a constituent who had booked for a particular date, and then because of all of the new clinics that are up and running, was able to get an earlier date. My understanding is that when you do that, the system automatically deletes your later appointment. In this case, the system did not delete the later appointment. So when she inquired about that at the mass vaccination clinic, she was told you have to call manually to cancel the second appointment, the later appointment. When she called to do that, because she was diligent, the operator told her, don't cancel the later appointment because otherwise you will lose the second dose appointment. That just seems a very inefficient way. So I just wanted to flag that for you if you were aware of that. This could be because there's so many now different ways of booking, and people are rebooking because there's so much availability now, I know. So if you could answer those two, thank you.
So yes, so through the chair to Councillor Demurla, thank you for the questions. In respect of second doses, this would be a provincial direction that we would need to discuss. I do know that the Ontario Science Table is looking at the best way to roll out second doses, whether there be, similarly a focus on communities that have seen high transmission versus not, or whatever the case might be, just in recognition of how transmission patterns have impacted the province. But ultimately, we would need to abide by provincial direction. Now, the province has indicated that highest risk healthcare workers, as well as urban Indigenous, as well as there are still other people who are able to have who are exempt from the extended dosing interval for second doses, and they may very well release other groups depending on where we get to the end of the month. But ultimately, it will be the province that will decide how second doses proceed across the province and in Peel. And so we will continue our conversation with our ministry partners. I think they're very aware of the risk that exists in a hotspot area such as ours, and how they might how second doses might assist, at least in really addressing the epidemiology and getting us to those sort of levels. But they also need to balance the recognition that there are first doses that will also be needed elsewhere in the province. So we'll have to see what happens and how they choose to develop the strategy as well as the allocations, and we will obviously work with them and abide by whatever protocol the ministry comes up with. In respect of the second question around booking, so this is a known issue. Typically what happens with people who book in the provincial booking system, they get their appointment, their first and their second dose. And then if they are booking, for example, with the hospital system or with the Region Appeal system that we've opened, they then might get a first dose appointment there, but then would need to sort things out. But I believe there is because all the vaccines are ultimately reported into the provincial booking system. I believe that if they've had one dose, then if they were to cancel their doses and try to go back into rebook, they would then access, they would be booking essentially a second dose within whatever guideline or protocol is there. But it is correct that if they were to cancel it now, they're usually given both doses right off the bat. And if they cancel it, they cancel whatever confirmed second dose appointment is there. I would say it's probably not as much of an issue to cancel an appointment and get that second dose, because the reality is that with increased supply, we may see a shortening of the interval anyway, and those second dose appointments may need to get changed. So so I would say, this is just a function, I believe, Councillor Demurla, of all the different booking systems that are in use. But I don't believe there's as much of an issue of addressing second doses, because my gut is that as we get more supply and there is an interest at the provincial level, a lot of those appointments that are being scheduled tentatively for second doses in the future are likely to get moved anyway.
So if I may, perhaps the operators may be told to not tell people to not cancel. Maybe they need to change their messaging on that.
So through the chair to Councillor Demurla, that's the provincial booking system probably, and so we'll be happy to provide that input to our provincial colleagues.
Thank you.
Thank you.
Thank you. Mayor Brown.
Yeah.
Mayor Brown, can you hear me? You're up.
Yeah, now I can hear you. Sorry, I was just giving an Eid greeting, but I'm now with you, and I want to thank Dr. Lowe for that presentation. The first question I had is he talked about supply in terms of May 21st. I know this is something that we've talked a lot about during our mayor's calls about maintaining the higher level of supply. I understand that right now we're at 11% of the provincial supply. We're 10.5% of the population, and it's critical that if we have this continued focus on hotspots, we're able to maintain that supply. And so I guess to Dr. Lowe, at what point would you like regional council to speak up and do some advocacy to maintain that supply post May 21st? And if we don't have that supply post May 21st, what are the repercussions of that? How could that hamper our efforts to effectively protect Peel Region?
So through the chair to Mayor Brown, I'll start and then I'll maybe have Brian Laundrie speak to the details around the numbers. You know, I think one of the things about increased supply is also making the most of the allocation that we've received to date. We have seen a significant growth of interest in first doses, and we're vaccinating close to 20,000 people a day throughout our entire system. That demand for first doses is eventually going to dry up. So I think there's a lot of other variables at play here. Certainly the second dose strategy, the harder to reach populations for which we would still have allocation perhaps to actually get to. And then the need to really recognize that while there is a focus on Peel and hotspots, there is also a need to vaccinate elsewhere in the province, because that ultimately will protect us as well here in Peel by ensuring that there's reductions of transmission elsewhere in the province, people that might be coming in and out of our community. So my inclination and my view is that at this point in time, we continue to work through our allocation and review the demand that's already there. As I mentioned, even for something like Doses After Dark, which is our attempted trial of a 24/7 operation, we're not seeing a lot of uptake in the overnight hours. Now, it could just be it's the overnight hours, but it could also be because as we're now at 50%, adding 14% this week, and then getting closer and closer to 75% first doses, there will always be a proportion of the population that won't, as Brian indicated, on the very end of the vaccine hesitancy scale. But there will also be some people where it is imperative for us to actually do a little bit more work, et cetera. So we're all of these different factors are coming in. We're getting to a place where it may not just be increased supply that is going to get the last bit vaccinated, but it is increased outreach and increased work that we're continuing to do. It may not necessarily be, getting first doses in, but what are we doing about second doses? So that's all stuff that we're trying to navigate with the specifics of the allocation and trying to also match to the extent possible with the capacity we've built. So, Brian, I don't know if you wanted to talk a little bit about the plans for if we don't receive the additional allocation, and then really what that means in terms of just some of all those overall themes that we're trying to navigate at the same time.
Sure. Thank you, Dr. Lowe. I'll just add a little bit, and what you really highlighted is the complexity of the system we built with the multiple streams, and the fact that a number of those streams are onboarding now with, first of all, our increased fixed clinic capacity, then with primary care, then with pharmacy, and the overall workplace and community pop-up strategies. So these are all variables that we're watching very closely. We have to see how they unfold. We've been optimistic in our modeling to make sure that we're not getting ourselves short on what we think we might need. But realistically, things may take a little longer, and our supply might last a little longer than the 21st date. We're trying to stay on top of that data. We're working also closely with the province, who are also looking very closely at our data, and we are meeting with them now regularly on a weekly basis to ensure that we're on the same page and that we won't be under allocated. And so I would say when we get to that point where we think we will be allocated and the province doesn't agree, that's the point that we would want council to get involved. And Dr. Lowe will bring that to your attention, I'm sure.
Okay, thank you. Mayor Brown, that takes you to 5 minutes, and I apologize, and I should have said it to Councillor DeMerla as well. After your 5 minutes and 2 questions, if when I go through my list, you have a question that still wasn't answered, of course you can come back on the list one more time. Moving on, Councillor Sato.
Thank you, Mr. Chair, and thank you, Dr. Lowe. A couple of questions. Some of the other regions are offering the vaccine to 16 plus who are working in essential services like grocery stores, etc. And of course, our residents are asking when their kids that are working part-time can get vaccinated. So that's my first one. The second one is you mentioned the overnight at the International Center. You were getting mostly daytime appointments. I think probably part of the reason is that it's very hard if you don't have a car to get to the International Center. I just did a check on my way, and it's an hour and 28 minutes from Meadowvale, including 10 minutes of walk at 1 a.m. There's no bus then between 1 a.m. and 4:30. So I'm not surprised if you wouldn't be getting from most of Mississauga, because I would imagine a lot of west of Highway 10 would be in the same situation. So my question to Brian is, are we looking at trying to provide some form of transportation for people other than TransHelp, which is only for 65 plus? I think we really need to try and get Mississauga residents to the clinic in their community, as the numbers you gave us a week ago was that only 36% of the people being vaccinated at the International Center are actually from the region of Peel. So I don't know whether you're setting up transportation for the Malton residents, which I think would be very critical, because I'm sure, I don't know what their bus service is like. So transportation is the really big one. The 16-year-olds, and also, you know, really trying to keep on to the province to keep our doses up, because 11% is not 50% more, which is what they promised. So thank you.
So through the chair to Councillor Sato, and I'll start, and Brian, you can fill in any details that I miss on both questions. So we have brought the question of 16 plus as Group 1 or Group 2 essential workers to the province, because we use the province's booking system, and they are committing to look at how they can get people under the age of 18 to be able to book via the provincial booking system that we're on. We have confirmation from them that they should be eligible based on being part of Group 1 and Group 2, but unfortunately the current provincial booking system has an age limit at 18 plus, so they are working to resolve that, and so we will continue to work with the ministry to ensure that that can be done. In terms of the transportation pieces, I understand that there's actually taxi chits that have been made available for the overnight hours, and that's the information that you can share to your residents for people who have barriers to access and can't access the International Center any other way via the overnight hours. And we certainly recognize the 36-40-ish. The International Center has always seen about 40 to 50% Peel non-Peel split, just by virtue of where it is on the border with Toronto. But we, in conversation with Toronto Public Health, anecdotally, I understand that the Toronto Congress Center on the other side of the border is also seeing a similar split. So I think it really just reflects the location of that community. But we are very committed to making sure that we have transportation options. I believe we've also been doing significant outreach in the Malton community, and I'll pass it to Brian to just confirm the details on transportation that I've shared, and any other details around how residents can access if they can't get to the International Center any other way.
Thank you, Dr. Lowe, and thank you through the chair to you, Councillor Sato. So we have a place on our webpage that talks about it. I'll give you the TransHelp and taxi script messages that Dr. Lowe gave. TransHelp extending its service until 2 a.m. in the morning, and then opening again at 6 a.m. Sunday morning. And there's a way to book that trip online or through a phone call, and then the taxi script is another option where we have a substantial amount of scripts available, and those are for residents with transportation barriers and that have an overnight vaccine appointment as well. So those are extended options that we have, and you can use the TransHelp if you have mobility issues or if you need to and you're under 65 for those hours that I represented. We also have the Paramount and Save Max Centers opening with extended hours. those same evenings. So starting today, so that might be cutting in also to those who otherwise would have booked at the Doses After Dark. So we're looking at lots of options, but thanks for your insight on that.
Okay, thank you. And Mr. Chair, could I ask again that, as we did last time, that the video of Dr. Lowe and Brian's presentation be provided to us? I know my residents appreciated being able to watch it last time. So we could do that all the time. Thank you.
Absolutely, and it was a great suggestion and well received. Thank you, Councillor Sato. Moving on, Councillor Kovac, your question.
Thank you, and through you, Mr. Chair, just two questions. I want to thank right off the bat, though, Brian Laundrie and Dr. Lowe for making yourselves available this morning, but also very much so for your time recently for Mayor Crombie's hosted teletown hall in Mississauga, which I thought went very well. Thank you for making yourselves available whenever we ask of you. Thank you. In light of, would be my first question, the cases involving VITT, 52-year-old woman in Alberta passed away, 54-year-old woman recently in Quebec, 60-something-year-old woman in New Brunswick passed away, and the uptick that we're seeing, I know it's still being portrayed as rare, but in Ontario, enough so to have caused a pause on the AstraZeneca. The messaging to date from the federal government, Health Canada, politicians up at the level, and that trickle-down effect has been more or less along the lines of Canadians should take the first vaccine that's made available to them. Recently, I've noticed, and I think it's kind of coming on the heels of this, even Patty Hajdu, the federal minister, said, well, really, Canadians should ask their doctors what is best. So there's maybe a little bit of a switch in tactics that are being taken. And in March of earlier this year, on the 11th, we had a motion that was proved here at the council table requesting Peel Region be included in the pharmacy pilot for the AstraZeneca. And obviously we're very eager, perhaps overeager, but around that time as well, we saw that there were multiple suspensions of the AstraZeneca in particular in Europe. Do you think, as my first question, we should maybe show a little bit more, I don't know what the right word would be, sensitivity, patience going forward, and maybe similar to how our federal partners are switching up the messaging, maybe similarly be using that?
So through the chair to Councillor Kovac, I think the pause on AstraZeneca really reflects the ongoing evolution, both of the science and context in which the vaccine program is being rolled out. And I think you will know that the National Advisory Committee of Immunizations have said that while there is a preference for certain vaccine products, there's also recognition that the local context be applied. I think the decision to include us in the pharmacy pilot, especially when we were seeing significant rates of transmission of COVID-19 and hospitalizations and intensive care stays related to severe disease, was absolutely the right thing to do at the time. And I believe, it is really unfortunate that a lot of the messaging on AstraZeneca is really specifically focused on certainly the regrettable passings that were associated, that were purportedly associated. Right now, I know they're being investigated. I don't believe that they've been clearly confirmed by the National Advisory Committee on Causality Assessment. But the focus seems to also ignore the fact that it has been a very effective and safe vaccine elsewhere in the world. It actually was the majority vaccine that was used in the United Kingdom's vaccine rollout, and over millions and millions of doses really changed the tail of the tape in that country. We also have to remember that in many parts of the world where COVID continues to be very prevalent and transmitting significantly, that AstraZeneca is the vaccine that is being developed through the global COVAX sharing facility. And so I think it really, I think the message I would deliver is it really does matter in terms of the context that you're operating in. And certainly, yes, if you're in an area with low COVID or no COVID, taking AstraZeneca may not necessarily, the risk benefit there may not necessarily pan out. But in a situation when you're in one of the hardest hit communities in the country, where COVID-19 itself causes blood clots in 1 out of 5 cases, the risk-benefit ratio is slightly different when you're considering the protection that AstraZeneca could produce versus remaining unvaccinated. So I agree with you. The message does seem to be evolving, but I think it's because our context and our understanding of the science is also evolving at the same time.
Thank you for your reply. And just on to my second question, I'll try to keep it to a very short preamble. Mr. Chair, when we are approving these vaccines, I can only imagine the intense research that's going into it, including clinical trials that also would have been or are done. And the Johnson & Johnson is very similar to the AstraZeneca in that they're both viral vector vaccines. Dr. Leana Wen in the United States, you might know her as the medical analyst and doctor who is on CNN. She's CNN's medical analyst. She was asked last month, you're not only a doctor, you also took part in the Johnson & Johnson clinical trial. And they started talking a little bit about TTS and the effects and she said, at the time, I didn't know about the risk of TTS even after we concluded the clinical trial. To be clear, this is a very low risk, though it's one that appears to be concentrated in one specific group. And we start seeing in towards the end of April, it was looking like there were 15 cases in the United States. All were women. We're now up to 28 in the United States. 6 are men, 22 are women, mostly in between the ages of 18 to 49. It's causing concern amongst women in particular who are following this and these patterns.
Councillor Kovacs, your question, please, Councillor Kovacs. To your question?
My question is, do we have any idea at this time why it seems to be affecting women more so than men?
So through the chair to Councillor Kovac, this side effect is continuing to be studied. And little known fact, I actually attended an international medical students conference with Dr. Leana Wen back in 2006. So I will reach out to her to try to figure out what her experience was. But I would highlight, if anything, that this is an active area of research as to the mechanism and the pathophysiology to understand the vulnerability of certain groups or the apparent vulnerability of certain groups to have a predisposition towards this rare side effect. But again, the numbers you're quoting in respect of the observed side effect are based on, presumably hundreds of thousands, if not millions of doses by this point in time delivered in the United States. And especially when considered in the overall context of significant COVID-19 transmission in that country, really needs to speak to the risk-benefit that's being undertaken with any vaccine product and intervention in terms of the protection and the rare side effects that may be associated with the vaccine versus the risk of remaining unvaccinated in a high transmission area. Thanks. I'll pass back to the chair.
Thank you very much for that, Doctor. And as somebody who supports Vision Zero and the message, no loss of life is acceptable, I take that here as well into this field, really believing that. Thank you.
Thank you. Councillor Dasko, your questions.
Thank you through the chair, and appreciate Dr. Lowe and Brian for joining us today, giving us the update. Finding it very interesting, and it's good to see that we're making progress. Every little bit that's moving forward is definitely helping for an end in sight. I guess 2 questions that I do have is, first of all, I'm just wondering if you could address, I've been trying to ask this question, is there's organizations, one in particular that I've been asking about, very vulnerable population, those that utilize and are members of Community Living Mississauga. And I'm just wondering if there have been any measures to reach out to them, to work with them, and to accommodate members of that community to get vaccinated. That'd be my first question.
So through the chair to Councillor Dasko, I believe this is concerning our community outreach and mobile program. So I will pass it to Brian Laundrie to speak to the specifics and details on that.
Thank you, Dr. Lowe, and through the chair to Councillor Dasko. Yes, I passed on that question to our mobile team. I think what I emphasized through the presentation was the multiple streams of vaccination that we have developed in our community outreach and our mobile program. We continue to have to expand that capacity to reach those the most vulnerable populations, and I understand that community is one of them on the list. It's just a matter of time and resources because all of our strategies draw on the same resources. So hopefully that happens sooner rather than later, but it's definitely been on the radar.
Okay, if you could please, I would appreciate some work being done on this because honestly, and I think you do know, I've been asking this for well over a month now, and I really, this is as you said as well, this is a very vulnerable community. And so I just wanted to see that we can actually take some targeted measures with regards to the program to look at how we might be able to serve them. So if you're able to perhaps give us an update, all Peel councillors an update on this as as soon as you're able to, that would be great. And then my second is, I guess. Part of that is, again, back to the mobile component, and that's getting out into the community. I do hear from seniors on a regular basis. I know a lot of us around the council table hear from seniors that are very concerned, that are not able to get out to the clinics and would like to have some sort of mobile facility. Those that we do hear from tend to be in apartments or condominiums. I think I mentioned before, there's one in particular in my ward where over 70% of the particular condominium building are seniors. And I'm just wondering if there's any I guess where in the pecking order we might be for the mobile clinics and anything of that nature that we might be able to address some of our seniors that haven't had the ability to get these types of vaccines, because some of them that I hear from are fearful of getting into, say, somebody else's car or vehicle or a wheel trans. They really don't want to move anywhere until they get the vaccine. So has there been any considerations on that in the mobile strategy?
Through the chair to Councillor Dasko, I mean, that's been the entire focus of our mobile strategy and community outreach, but the reality is that the hardest to reach are the hardest to reach for a reason, right? And so I think we continue to do our mobile outreach. We were asked, and certainly by council, asked in April to pivot our strategy to focus more on mobile and workplaces, which we have done, but that has necessarily slowed down our outreach to senior congregate settings, which was our original focus. And so, I mean, unfortunately, the resources are finite, and that's just how they go. But I think there are mobile clinics that continue to be delivered every day, and we have the teams out there doing both homebound strategy with the 4 paramedic teams, as well as all of the other mobile clinic offerings that are now being spread out amongst workplaces, places of worship, and also in ongoing outreach to senior congregate settings. So I don't know exactly where in the pecking order any of these would be, but I will pass it to Brian in case he has any specifics on the details. Really, it is a matter of finite resources, finite allocations, and just trying to make sure that we are addressing all the different priorities that we have been charged with. Brian?
Thank you, Dr. Lowe. And through the chair, Councillor Dasko, we're on the same page. Dr. Lowe's covered it. It's just not enough to do everything all at once, and we're trying to get there as fast as we can. We're trying to expand that mobile capacity as quickly as possible, given the resources and allocation. And our hope is to continue to stay focused on that population throughout until we get to everybody. Thanks.
Thank you.
Thank you very much.
Thank you very much. Great conversation. I'm going to limit my comments because I have great access to you guys anyways. I also just wanted to say congratulations. We're over 70% on 50 plus and just under a third of 18 to 49, and really moving quickly now that we're vaccinating at a rate of almost 18,000 a day and 125,000 a week. That's very impressive. So thank you. I'll just read out my questions and then you can answer them all, and I'll try and get out of here in under 5 minutes. Mr. Chair, you'll be happy. the announcement of the Bruce Power Clinic looks like it could be one of the largest in Ontario, and I know that Electra will be a sponsor of that clinic. I wonder who is eligible, when it will open, and how many doses will they be provided? Will this be out of our allocation or the provincial, and how will people register? I wondered if it was just for power workers or open to the community. So number one. Number two is with respect to the pause on AstraZeneca. What is your feelings on mixing cocktails of vaccine for second doses? And so it would be safe to use a different vaccine if you had AstraZeneca for your first dose. And when do you anticipate the second doses will start? I know they have for frontline healthcare workers. And then finally, the question I'm always asked is about the variants. I don't see on the epidemiology report the presence of the India variant B1617. I wonder if you want to comment on whether, I guess it would be on the report if it had a presence here in Peel, but given our demographics of our population, you would have thought that it would be. So I wonder if you want to comment on the prevalence. I guess is the UK variant most prevalent, then South African, and less so Brazilian, or is that the other way around? And I don't see evidence of the India variant here at all. Thank you. Those are all my questions. Pass the floor on to someone else.
Through the chair to Mayor Crombie. So thank you. First of all, the Bruce Power facility will be open to the public and will follow the existing eligibility requirements. Brian may be able to fill in the specific details on numbers. This is a facility that will also help us to make the most of the increased allocation that we have received, and is actually part of our overall ramp up strategy in terms of trying to bring more opportunities for our community to access vaccination. In terms of the specific numbers, it will be one of the largest in Ontario, if not in Canada, and I'll pass it to Brian to speak to that in a bit. In terms of the AstraZeneca, the National Advisory Committee Immunization is expected to render a decision based on European data and UK data around mixing and matching. I think we've started to see some of the findings of those studies that were conducted in the UK start to come out, which suggests that people can mix and match. It has the same effectiveness, but there may be more side effects, just in terms of some of the mild side effects that people experience following vaccination. But I do know as well, one other thing that is on the table and being discussed at the provincial level is whether existing doses of AZ will also be reserved for individuals to get a second dose of AZ as well, because the pause only impacts first doses at this point in time. It does not necessarily impact second doses, and there hasn't been as much VITT or thrombosis seen with the second dose in that sense. And then I think the last thing in respect of variants, and I'll start, and Manali can maybe chip in if I've misspoken or detailed, but my understanding is that right now we're in the midst of a significant third wave with widespread propagated community transmission driven by B117. So that actually means that the opportunity for B1617 or any of the other variants to really get a foothold in our community is quite limited just by the extent of transmission of B117 in our community to date so far. Obviously, the other variants of concern will come into play when we exit from the third wave, and if we do need everyone to get vaccinated as much as possible, so that there isn't a possibility of a resurgence driven by any of the other variants. So maybe Brian, over to you to speak specifically to the details on numbers around the Bruce Power funded facility, and then Manali around just confirming what I said about variants.
Sure, and just quickly, the Bruce Power facility will be a community clinic, not a workplace clinic, so it's open to all, and according to the eligibility, and it will have the capacity, theoretical capacity of a 9,000 per day maximum. We'll be starting slowly with that because we have to match that capacity in with the rest of the capacity in the system, and with our allocation. And I talked about the complexity of the various streams coming together. That has the overlay of second dose opportunity overlaid on it as well. So depending on how quickly the second dose framework shifts and comes online, it will impact how quickly we ramp up that capacity. But all the paperworks and last details are still being finalized, but it looks like an opening late next week.
and through the chair to Manali then to answer the question on variants.
Thank you, Dr. Lowe, and thank you, Mayor Crombie, for the question and through the chair. So Dr. Lowe was correct in saying that B117 is driving our transmission here in Peel. We have seen an increase. So the order is B117, then the P1, and then the B351. P1 we've been watching that. It's increased to about 8% of the total variant cases over the past week or two. We have had a report, so it's Public Health Ontario lab that is reporting on other variants of interest. As you probably heard, the World Health Organization is now calling the B1617 a fourth variant of concern. We have had 10 reported to us in Peel with no clear transmission from these. So as Dr. Lowe was saying, it's the B117 that's really the foothold in Peel.
Okay, thank you. Councillor Paleshi.
Thank you, Mr. Chair. Thank you, Dr. Lowe. Dr. Lowe, if you can be brief in your answers, I would appreciate that. I could only have 5 minutes. I have 2 quick questions, and I hope to put forward 2 quick motions. My first question, Dr. Lowe, with respect to the vaccines that we get in Peel, are we keeping track with, and this may be a question for Brian, are we keeping track of the people that are coming outside of Peel that do not live or work in Peel, but are using the facilities, specifically the Save Max and Internet and Paramount? Are we keeping track of the vaccines that are going outside of Peel and vice versa for the Peel residents that are leaving Peel going into outside municipalities? Are we keeping track of those vaccines as well?
Thank you, Councillor Paleshi, and through the chair, Dr. Lowe, maybe I'll just jump straight into it. Yes, we do keep track. We keep track of it by each clinic. Most of our clinics are over 80% Peel residents. We also keep track of how many Peel residents are vaccinated in total, which means those that aren't in Peel are from outside. And right now we are over vaccinating more residents from outside than our residents go elsewhere. I think that's a function of the system, and that people have that flexibility to book across borders. And given it's a provincial program and system and vaccine, we of course have many targeted strategies for just the residents to Peel, but we do look closely at those numbers that you're speaking about.
Thank you very much for that, Brian. A quick comment, I'm still a little bit disappointed that we haven't closed the borders to leisure travel yet through air, train, and land crossings. But what I'd like to understand, Dr. Lowe, is once I'm fully vaccinated, and I guess it depends on who the person is, but once you're fully vaccinated, and then if you catch COVID, is it basically it's downplayed to like flu-like symptoms where your immunities have built up, and is that typically what the vaccination does for everyone? So COVID, you can still catch COVID, but it's not as bad as it would be if you weren't vaccinated. Is that correct?
So through the chair to Councillor Paleshi, the 3 goals of the vaccine program are to reduce mortality, to reduce severity, and to reduce transmission. So with 1 dose, you already accomplished most of the first 2. There's been indication that 1 dose of vaccine provides you with significant protection against death and severe disease and hospitalization. And with the 2nd dose, you start to go a bit of the ways to hopefully reducing transmission, really even the development of the disease to begin with. Depending on the vaccine. So you're correct. In the long run, once we get to a situation where COVID is likely going to become endemic, at least having the vaccine means that it's basically just like getting a cold or a flu that your body can fight off without ending up in the hospital, and hopefully reducing transmission of that disease onto other people as well.
Great. Thank you, Dr. Lowe. Dr. Lowe, you tell me if you need this in a motion. I would be happy to put it forward. I think the doses after dark concept is fantastic. I think that it needs to be in a more centralized location for the next round if we are looking at doing it again. Therefore, I'd like to put forward a motion that the next doses after dark that we put forward is in a more centralized location for all of Mississauga, Brampton, and Caledon. Do you need that in the form of a motion, or can you take that as staff direction?
To the chair, I believe we could take that as staff direction to consider. And also, I'll just state, Councillor Pleshy, it will depend on the success of this event as well. Again, this is a pilot to really trial overnight offerings and to see if it's uptaken by the community. Certainly, we've received some good advice here, and we would rely on council support to ensure that everyone tries to make this one a success, so that we have a justification for potentially planning other such events in more centralized locations on the go forward.
And Councillor Pleshy, I think that's a very good question you ask, and I think it quite rightly is direction to staff that before next steps, they come back and report on the very matter that you've raised, and it is a good one. So your second item, tell me quickly before if I have to put you back down the list for a motion, what was the second item you wish to have addressed?
Yeah, just on the doses after dark, it's hard to know what it could be since it wasn't in a centralized location. So look forward for more information. My second item is a motion that I request that we have COVID update, special regional council meeting COVID updates on a weekly basis until the pandemic is over or until this council chooses otherwise. That's a form of a motion that I'd like to put forward. Thank you, Mr. Chair.
Okay, I'm going to deal with all the questions that I have first, then I will come to you as the first person that would like to put a motion forward. So carrying on with my list, Councillor Groves.
Thank you, Mr. Chair, and thank you, Dr. Lowe, Minalia, and Brian for your presentation. And Dr. Lowe, I just want to say a special thank you on behalf of myself and my community to you and your team for getting L7E into the hotspot and really all of Peel. So thank you very much for that. I just want to focus on the whole primary care piece. Brian talked about in his presentation, sort of building the confidence in the community around vaccinations, because there's a bit of a, I guess a caution when it comes to vaccines with regards to residents. So I've been speaking to a number of my primary care physicians in my community. And one of the things that they've indicated is that currently the way that they're operating, they can vaccinate about maybe 50 to 60 cases per day. They've talked about getting together and having maybe just having a centralized location right next to their facility so that they can actually vaccinate a whole lot more. And the number that they spoke about that they would be able to do it in a more centralized location would be about 500 to 1,000 a day, which I think makes a huge difference, because the whole idea here is really get as many people vaccinated as we can. So I guess I'm asking Dr. Lowe through you, Mr. Chair, to Dr. Lowe and maybe Brian, is that are you able to just work with the chairman and myself in getting this looked at or up and running, because it really is a no-brainer for me anyway. With it's a no cost to the region. We've got primary care physicians who are well trained, and they will be using their own staff. So can I leave that with you and have you work with the chairman and I on that?
Through the chair, I know that Brian Laundrie has been overseeing the primary care rollout, so I will defer to him as to provide the perspective from the team as to what might be possible.
Okay.
Thank you, Dr. Lowe, and thank you, Councillor Groves, and through the chair. Yes, as I reported here, we've been working with our primary care leaders in the primary care working group since the first of the year on all the primary care strategies. So recently, as we've received more vaccine and had the opportunity to pilot primary care hubs with Pfizer, because it at the moment looks like the most reliable vaccine in terms of delivery and allocation throughout the summer. Put the question through our leadership group to each of our municipalities and to their Ontario health teams to coordinate within their systems locally to determine how multiple primary care groups could work together. There are several in Bolton, several in Caledon East, several across Caledon, and the Ontario Health Team is taking the lead in pulling those groups together. As an initial phase, we've allocated some Pfizer to the Goodfellows Family Health Team to trial how the Pfizer could be run out of one clinic. And that's gone well, but the goal is to expand beyond. And our team with the primary care working group with the Ontario Health Teams have been meeting to coordinate that response there. So I would ask that we allow that process to unfold. So we pull in as many partners as possible and make it as equitable as possible. We're doing the same with 4 or 5 other hubs throughout the region to pilot the use of Pfizer. And then we have the stream of Moderna coming into 24 primary care clinics as well. So looking at early lessons there. So I just want to be careful about jumping too quickly into a longer term solution before our leadership teams have had the opportunity to do their work and to look back at the lessons learned and evaluate the best strategy moving forward.
Okay, well, I'm going to look forward to a conversation offline, Brian, between yourself and the chairman, because I did have some concerns from the Goodfellow primary care physicians, and it isn't, a long term. I mean, they're happy to work with whatever it is that the region has can work with them on. So anyway, I will have this conversation offline and look forward to that. Thank you.
Thank you, Councillor Raz.
Thank you very much, Mr. Chair, and through you, Dr. Lowe. Quick question, clarification on the under 18. So I think it's the 16 and 17-year-olds. Understanding that at this point they can't book through the provincial system, but would they be able to book through the Trillium Health Partners if they fall into Group 2?
So through the chair to Councillor Raz, I don't actually know much about Trillium's booking system, to be honest, but that's a question we can take back to look at our hospital partners and even our own region appeal system to see if that's something we would we may be able to accommodate through the additional booking systems that have been brought online at those clinics. So we can take that back.
Okay, thank you for that. And lastly, if we adjust the ages for the doses after dark, I know I go to bed early, but my kids are up really late. So, if we're trying to reach a younger audience, perhaps this might appeal to them and throw in some rave music and you'll have better uptake. Thank you.
Thank you. Councillor Downey.
Thank you, through you, Chair. I'm on the same track with Councillor Raz, with some teenagers in my house that would love to have a normal summer. My 14-year-old daughter sent me the Globe article in regards to 12 plus and the Pfizer vaccine. So Dr. Lowe, I'm wondering if you have any thoughts or information on that and when we would maybe expect to see that in Ontario.
So through the chair to Councillor Downey, so the question on 16-17 is really around that Councillor Raz raised was around Group 1 and 2 essential workers who arguably should be able to book by virtue of being Group 1 and 2. We've been asked by the province on broader pediatric populations from 12 to 17 to wait for the province's pediatric table to complete its review as to how they'd like to see that group as a general population age bracket be opened. So that work is pending and pending provincial direction at this time.
Thank you.
Okay, thank you. That exhausts my list. So I had a notice that there was a motion to be put on the floor. Councillor Paleshi.
Thank you, Mr. Chair. So I'm happy to wait for the doses after dark to see what happens this weekend, and hopefully staff consider a more centralized location. As for, and I have to say that, the mayors have been doing a fantastic job, going back to their councils and answering as many questions as they can from their councillors during our municipal COVID updates. That being said, with this new, you have 11 members, some 12 members asking the mayors questions, and they're probably not given a 5-minute timeline with a 2-question max on their updates with Dr. Lowe. So I'd like to, we've talked about it a few times. I'd like to put forward a motion that we have weekly special regional council meetings on just the COVID updates, and for them to be worked into the every Thursday going forward until the pandemic or this council changes its mind otherwise.
Okay, thank you. What I'd like is just some first thoughts, perhaps from the clerk, perhaps the CAO. Simple things like, if you want to start this immediately, I'm looking at my scratch pad on my desk. And so next Thursday, do we cancel waste management, audit risk committee, accessibility, or do we do them afterwards? Do we call those people in on, like, there's a lot of logistical issues, but that's my first thought, how we would schedule them in accordingly. But having said that, over to the clerk and the CAO, and then Dr. Lowe, how does this relate to the work that he needs to do? Can he make himself and the team available? But what are the moving parts is what I would ask. Perhaps over to Catherine first.
Thank you, and through you, Mr. Chair. There is a logistical issue with scheduling special council meetings every week, and the procedure bylaw saying that regional council meetings will only be on Thursdays, and the existing schedule that we have with the committees, and the tolerances as well for early or late meetings, as again the procedure bylaw sets out 9:30 to 3:30 for these meetings to take place. I also wanted to point out the other available opportunities to get information from Dr. Lowe and the team through the regular emails that Dr. Lowe sends, as well as you pointed out, Councillor Paleski, the mayor's meetings and the updates that the mayors have been providing to the local councils, as well as the number of times that Dr. Lowe and team attend local council meetings, as well as other events and opportunities to inform both council and the public. The issue also becomes not only the logistical concerns, but the concerns with the time factors involved for Dr. Lowe and his team, and the work that is involved in not only preparing these presentations, but taking them away from other work that they could be doing. So it really is an issue of having to logistically create the opportunities for special meetings, as well as taking into consideration the vast amounts of information that is already available to council from a variety of means. And I'll leave it at that for now and see if there's other comments from council. And we do need a seconder for the motion.
Okay, and I'll come back to that. Through to the CAO.
Thank you, Mr. Chair. I think Catherine has really covered some of the critical points that I would make as well. I mean, look, we're in council's hands, and if this is something that council needs, then we will certainly find a way to make it work. I do think that it does place an additional burden on a team right now that, quite frankly, is already stretched. But I do take the point as well. I know that both Brian and Dr. Lowe have been invited many times to local council meetings, which often happen on those off weeks when there isn't a regional council meeting happening on Thursday. And I think that to a large degree closes the gap between the Thursday meeting here at the region and any particular inquiries. And I know while there are broad and general inquiries that come from council, in many cases, the concerns are around things like, access to vaccinations at a local level. And these are certainly issues that can be addressed through appearing as a delegate at local meetings. So, I can't say that at this point, we can't accommodate a special meeting. Of course, if that's council's wish, then we'll find a way to make it work. I guess I'm just struggling in some respects in terms of what is the gap that we're really trying to fill. As Catherine says, we do send out a lot of information, and I think our team has been very accessible.
Thank you. Michael, I'm going to come right to you, but I just wanted to make one quick comment because you put the motion before we discussed it, and I just want you to know I've given it a lot of thought as well. I'm going to need a seconder in a moment, but just as chair, I wanted to make you aware of these thoughts, some of the concerns that I have. First and foremost, fundamentally, when we convene as council, We're in the executive role of this institution. That's to execute the orders of the day. It isn't a chat line. It isn't, can we debate and discuss and ask some questions? That should be done at committee or through a process. We're here to vote on direction that we give. The other thought that I had is, and I thought about the private sector and then the government sector. Let's talk about the private sector where you may own shares in a company. You own part of the corporation. They have an annual general meeting. You can put your questions, they're dealt with. You can't, as a shareholder who owns the company, say 1 month later, I've got some more questions. Can you get the board of directors in, etc.? It's kind of cumbersome. They're trying to run that corporation, even though you own part of that corporation. But the final one that I fell to, and there's people in the room that have more experience than me, our MPs and our MPPs, the fact of the matter is, for the majority of the time, they're not in session. So do they say, bring everybody back because I'm in Kapuskasing and as an MPP, I've got a question and I need the Prime Minister or the Premier. Can everybody come? Because I've got some questions from my constituents. It's a very hard way to run an organization when you should have the organization doing these things. But finally, my biggest concern of all, and it's been touched upon, to what extent does it deviate Dr. Lowe, who's made himself greatly available, from doing the main task? We haven't had a meeting in 3 weeks. No question about it. You brought it up, Councillor Palleschi. This week, we are going to inoculate more people than we've ever inoculated. So it's not like we took the 3 weeks off. Staff have been working remarkably well to get us to where we are. So the system keeps working. So that is a bit of the concern. And then the one that I touched upon, the scheduling. What do we do on other Thursdays, etc. But having said that, Michael, I wanted you to know that I gave it some thought. The first thing I need before I put it on the floor, because I see a list, is, Michael, you put your motion. Do I have a seconder for the motion so I can put it on the floor for discussion and debate? One more time, if I'm not hearing or
Mr. Chair, I'm waving my hand at you.
So thank you. So Councillor Sato, you've seconded it. Thank you very much. So it's duly before me on the floor. My list of speakers to the motion is Councillor Parrish, Sato, Palleschi, Groves. Councillor Parrish.
Thank you very much, Mr. Chair, and thank you very much also for running a very tight meeting. I think it gets Dr. Lowe out of here at a reasonable time. Nobody went into second round of questions, which tells me maybe we don't need this extra meeting every week. The worst thing that could happen is that we get things canceled, like our MCR meetings. We couldn't get through the agenda last week, so we've had to put 2 on in January or June. I'm not going to support the motion. Every council has weekly meetings. I think the CAO and I think Catherine did a good job of explaining the complexities of it. I'm not the easiest person to put off. So I just think this is a little bit of overkill. I like being able to ask questions, and if I don't have any questions, I sit and listen to the answers given to other people's questions. So the information today was fulsome. Your organization of it was very good. And as I said, nobody went to second rounds. So I think we covered everything that needed to be covered today. And to pull on second meetings, disrupt the staff and put them through all the work of having a formal meeting, it is really not what we need right now. So I won't be supporting the motion, and I hope it doesn't pass.
Thank you, Councillor Parrish. Councillor Sato.
Thank you, Mr. Chair. Well, I'm supporting Councillor Palleschi's motion because, your explanation, Nando. We're not a private enterprise. We're not like that. We are elected. The people that are sitting around this table are elected by the citizens of the region of Peel to represent them. And the number of questions and inquiries that we get on a daily basis is out. I mean, all of us, you heard the questions today, that, we only get once every 2 weeks to ask our questions because, God forbid, we would send them in and get somebody to answer them and let our colleagues know what we're asking. I certainly find it very helpful to hear what other members of council are asking and suggesting. And, it's been 3 weeks. If I'd suggested at Mississauga Council about a month or 2 ago that we invite Dr. Lowe and Brian to attend our general committee meetings, which are on the off week from regional council, because we need to be able to ask the questions in public. We need our citizens to be able to listen in and to hear what we're asking. And that's important to them. You know, we bring their questions to the table. We bring their suggestions to the table, and they deserve to be hearing the answers directly. Press conferences don't cut it. You know, press conferences are, they're very fixed, they're very set. They're not the citizens and the councillors that represent them speaking to the subject or asking the questions. Dr. Lowe and Brian have only been able to make it to one of our council meetings. So no, we're not getting the off weeks with our access to the staff. And, you know, I don't care how we arrange it, but we need to do something on those off weeks, whether it's through the region or whether there is a firm commitment that we have a section on all of our meetings for COVID related. So whether it's a firm commitment that every other Wednesday on the off week when there's no regional council meeting, that someone from Peel Health will be there to answer questions from Mississauga Council, or whether you do something through a committee. I mean, you could do it at a committee meeting for the Health Services Committee. Fits into the categories. You don't have to call a full council meeting, but whatever we do, we need more access as the representatives of the people. We are the ones getting the questions. We're the ones that need to have the answers, because, you know, sending in a question through the clerk's office and not knowing who it's going to go to or when it's going to be answered is not acceptable. It's not efficient, and it creates a tremendous amount of work in all of our offices as well. And our staff are absolutely swamped, and I'm sure Brampton's are as well. But we're talking about the mental health of our staff here at the region, well, also at the city of Mississauga, the amount of abuse that our staff and our offices are taking from citizens who are angry, frustrated, can't find the information, and they want the answers. That's what we're dealing with. So it's not just, you know, we just want to know ahead of everybody else. We need to know. It's a need to know situation. So, you know, we need to do something. And I'm not sure, you know, how we do it, but we need to do better than we are doing to keep members of council engaged on behalf of our citizens. It's not for us, it's for the citizens.
Thank you. Councillor Paleshi.
Thank you, Mr. Chair. And so I won't restate what Councillor Stato had said, but I completely agree. And to everyone, if you know, back in February of 2020, I asked our then Peel Medical Officer of Health if we should start putting out messages on hygiene, on washing hands, and creating the social distancing, and the response from our then medical officer of health is that we should be more concerned about influenza. Now, I completely understand why that was stated at that time, but if we would have done something a little bit differently then, would we be in a different spot now? Who knows? And I don't want to dwell on the past, but I don't want to continue to say, man, if we would have changed. When I called Wave 3 to say, hey, we should be maybe changing it up here to see if we can get, you know, something else out, different messaging, do something differently, and we didn't do that. Maybe we could have done something. Maybe something could have been done moving forward. My concern is that with this ever-changing and evolving pandemic and world that we live in, I'm not talking about the vaccine rollout. I think staff are doing a fantastic job on the vaccine rollout, and I don't wish to discuss. I'd like the updates, fantastic, by way of email. But it's those other levels of governments that are changing policy, that are changing things that we need to look at, because, Mr. Chair, you and I both know that we are more in touch with our residents than any other level of government. We know more about what they want because they were in direct contact with us than everybody else. So when policy gets changed, when they make new rules at the federal or provincial level, how that affects us, how that affects our residents, we hear it first. And that's what I think meetings like this, where we are the decision makers, where we can push forward and move the advocacy that our residents need. And I think that's what we need to be able to do because of this ever-changing pandemic. If we think that the worst is over, then unfortunately, we thought that after wave 1, we thought that after wave 2, and we're starting to think that after wave 3 as the numbers start to come down. And I think that is a huge mistake. This is a perfect opportunity for us to continue the conversations and continuing to have that dialogue. We all represent different areas of the region of Peel, and we all need to let everybody know and understand that we're here, we're working for them, and we're continuing the dialogue. Thank you, Mr. Chair.
Thank you, Michael. Councillor Groves.
Thank you, Mr. Chair. And I will not be supporting the motion, and I think Catherine summarized it quite well. I think that our staff, they have been stretched to the limit. They've been overworked. They have been there steadily. I'm quite happy with the updates that I receive on a weekly basis, sometimes twice a week from staff. I know that when I have a question or I get questions from my residents, staff actually have been able to respond very quickly. And so I really don't have a concern with not getting information to my constituents on time or frequently. And I guess the other thing, to your point, Mr. Chair, and I completely agree, I think we need to prioritize. And right now, the priority is to get as many people inoculated as we possibly can. And, you know, having Dr. Lowe and Brian and the other team staff members here on a more regular basis, I think that takes them away from what the goal is. And really that goal is exactly what we said, is to inoculate as many people as we can to get this disease under control. So for those reasons, I cannot support the motion. I'm sure, Mr. Chair, if there are some policies or something urgent that comes up, it is at your discretion that you can call a special council meeting. So we do have that in our toolbox, that we can do that if need be. So thank you, Mr. Chair.
Thank you. Mayor Crombie.
Thank you. I think that Councillor Parrish and Councillor Groves and our clerk have summed it up nicely. I don't think there's any need. If we want to talk about being inundated and overwhelmed, let's look directly at Dr. Lowe and Brian Landry and the work that they're doing. I think, you know, they've got enough on their plate without having to report back to us anymore. They should focus on managing the pandemic and focus on managing the rollout of the vaccine, which they have been doing brilliantly, by the way. And I think everyone, you know, if you need heightened communications, we can ask that come out and everybody read your emails. But I think even demonstrated by today's meeting, we're getting enough information. And I don't think they need anything more on their plates to attend yet another meeting with council members. I don't think it's necessary, and I'm not going to support the motion. Sorry. Thanks.
Mayor Crombie, thank you. Looking at my list, I see no other speakers, but I will, a very important issue, great conversation. I will make one more call. Do I have any other speakers to the motion? If not, Madam Clerk, over to you. Duly moved by Councillor Paleshi and seconded by Councillor Sato. Madam Clerk, over to you for the recorded vote.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
Yes. Yes.
Mayor Brown in favor. Councillor Carlson?
No, thanks.
Councillor Carlson opposed. Mayor Crombie?
No, thanks.
Mayor Crombie opposed. Councillor Jamerla?
No. Councillor
Jamerla opposed. Councillor Dasco? I think I unfortunately can't hear you. Is that? Okay. Maybe can you give me a thumbs up or a thumbs down? That way I can.
Not supporting. Can you hear me?
Yes, I can now.
Okay,
thank you. Councillor Dasco opposed. Councillor Dillon had to leave the meeting. Councillor Downey?
Opposed.
Councillor Downey opposed. Councillor Fonseca?
Opposed.
Councillor Fonseca opposed. Councillor Fortini?
Opposed.
Councillor Fortini opposed. Councillor Groves?
Opposed.
Councillor Groves opposed. Councillor Innes?
Opposed.
Councillor Innes opposed. Councillor Kovac?
I'll support.
Councillor Kovac in favor. Councillor Mahoney?
No.
Councillor Mahoney opposed. Councillor McFadden?
Opposed.
Councillor McFadden opposed. Councillor Medeiros?
Support.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
In favor. Councillor Parrish?
Opposed.
Councillor Parrish opposed. Councillor Raz?
Opposed.
Councillor Raz opposed. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
Opposed.
Sinclair? Councillor Sinclair opposed. Councillor Starr?
Opposed.
Councillor Starr opposed. Councillor Early?
Opposed.
Councillor Early opposed. Councillor Vicente? Councillor Vicente? Not hearing from Councillor Vicente.
In favor.
The motion is lost.
In favor.
Sorry, Councillor Vicente in favor. Thank you. The motion is lost.
Okay, thank you. Thank you for the conversation. Thank you for the discussion. Okay, moving on. That deals with our presentations related to COVID. We've dealt with communication items. The next item I'd like to try and deal with before the noon hour is item 10.1, presentation from Anthony Parente, update on the Region of Peel inflow and infiltration reduction and mitigation strategy. Anthony.
Yes, thank you very much, Mr. Chairman, and good morning, members of Regional Council. I'm here today with Farshad Salizadeh to provide you an update on our inflow and infiltration strategy work, including other activities we have ongoing in the wastewater world. Now more than ever, when our homes are our offices, our schools, and our places of solace, there is renewed importance for protecting our residents from incidents of basement flooding caused by inflow and infiltration into the sanitary sewer system. Similarly, our parks, watercourses, and lakes are one of our few places of refuge during the pandemic, and it is even more important now to protect them from sanitary discharges to the environment caused by I&I. Our water and wastewater teams are playing a distinct part in protecting our communities, homes, and playgrounds. Today, Farshad is going to give you an update on the progress of our I&I strategy. Later, I will provide Council with more information on the important work our water and wastewater teams are doing to provide critical services to our community and support our community for life. May I have the next slide, please? And I'll pass it over to Farshad.
Thank you very much, Anthony. Hi, everyone else. Thanks for giving us the time. Our presentation is all good news. I hope that it will brighten up everyone's day a little bit. Let's spend the next 6-7 minutes to celebrate the success of the program. Our agenda has 3 items. The first one is an overview of the strategy. Next slide, please. Let's start with sanitary collection system. What is it? This is basically the second half of a cycle. A cycle that starts with the lake. We treat the water from the lake, put it in the tap, so you can drink the water or flush your toilets with it. Sanitary collection system is the second half of this cycle. From the point that you flush the toilet down the drain, we pick it up, treat it, and put it back in the lake to start everything over again. So what is I&I here? I&I is really any flow that's getting into the sanitary collection system that is not part of this cycle, such as rainfall or groundwater. Next slide, please. Why do we care about I&I? Because simply I&I can undermine the functionality of the sanitary collection system. How? The collection system is supposed to take the sewage away. I&I can push it back into your basement and cause flooding. The collection system should take it to the treatment plant. I&I can force it to go to the river and the environment. And also I&I can take up the capacity of the system, which could be used to build a new hotel, a condo, a hospital, or something. For these reasons, we care about it. Next one, please. So what can we do about it? There are two main big categories for dealing with INI. The first one is to stop it from getting into the system, which we call it INI reduction. And the second category is we would accept it coming in, but we will make sure that it's not causing any problem, that we call it mitigation. So in simple, stop and accept. Sorry, next presentation, next slide, please. All right, examples of INI reduction would be fixing leaky manholes and pipes, such as the ones that you see on the screen. Next one, please. As well as fixing or disconnecting downspouts or finding cross connections, cross-connected catch basins like the one that you see in the image. Next one, please. Examples of INI mitigation would be increasing the capacity of system by building bigger pipes, new pipes, twinning them, or building storage. Next one, please. In the past 3 slides, very quickly, I just listed a whole lot of actions and activities that need to be done to do the stop and accept work. Region is really big, and doing all that work everywhere at once is just not possible. So to deal with this issue, we had to divide the region into 40 pieces. We call each of them a block, prioritize them, and start the work on the ones that ranked to the top. This prioritization or these delineation is not based on political boundaries, rather than it's based on sanitary sewer network. Instead of going from a small neighborhood like Avondale, or go all the way to the region-wide, we've broken it into pieces, and we start with the ones that rank to the top according to the prevalence of the INI issues. The 3 red ones that you see on the right sides are the one. Next one, please. In the second part of the presentation, I would like to go through an example of how the stop and accept is happening with providing a real example. Next one, please. For the real example, we've picked Avondale, a neighborhood in Brampton, which is part of the Block 26, and that's exactly where I am right now, our office at 10 Peel Center Drive. The good and beauty of the block concept is that you can take that piece out of the entire region, do your work, and put it right back in as if it was a jigsaw puzzle. For this block, we have completed the INI reduction work, and the INI mitigation work is in progress. Next slide, please. Examples of INI reduction work is the brand new downspout disconnection program that we've rolled out since last time we appeared before the council. This is a truly outstanding program in comparison to anything that you would see anywhere else. This is outstanding because, first and foremost, it's perfectly effortless for the residents. They do not need to fill in an application. They do not need to pay for anything. We will do everything. We will find them. We will inform them. We will work with them, and we'll get the job done. If any of you or any of the residents have not heard about this, it's simply because it's not time. If there is something, we will go to them. They do not need to do anything. We target only the downspouts that we care about and is going to benefit us, and not put our effort somewhere else. And because this is a targeted effort, it allows us to go the extra mile. A lot of similar programs are only limited to just cutting a downspout and put an elbow on it. But in this case, we go the extra mile of doing a great job. The examples that you see on the slide on the right side is a real example of the work that we've done. You can see how beautifully we've gone around the flowers and dig a trench, put the pipe in, and the extension, let the water come out. Also, on top of everything else, we catalog every little thing about every little downspout. And this is to ensure you will never have to hear me talking about downspout disconnection in Block 26 ever again. Next slide, please. There are a lot of other work that we do to stop INI from entering the system that I can go on and on about. Manhole inspections, CCTV dye testing, smoke testing, flow monitoring, on and on, that results in finding cross connections, like the 4 catch basins that we found in front of the Balmoral Drive High School. those have been fixed and they're done. Next, please. All the INI reduction work together has amounted to stopping 25% of the INI entering the system in Block 26. Is that good? That's absolutely good. That's great. That's fantastic. We should celebrate that. However, keep in mind that the exact same set of actions could result in 50% reduction or 5% reduction. That's out of our control. What's in our control is to do the right thing in an efficient and accountable way and make sure that we never need to go back and do it. Okay. So what should we do about the 75% remaining? We need to accept it. Next slide, please. The very first question that you would ask is, why don't you just stop the 75% as well, just like you did with the first 25? The reason is our investigations in the field shows that the 75% is getting through via migration between the laterals. We could stop that, absolutely, 100%, by fixing the laterals, but that would involve digging up hundreds, maybe thousands of laterals and within private property. Is that a good idea, or we should trade that off with building bigger infrastructure within the right-of-way? I don't know. We don't need to decide the answer of that question because we are going to do a study that would tell us what is the best to do with this, which leads us to the next slide. That would mean we would build other infrastructure, the like of which we do a lot of them. Great, massive, major projects that are ongoing. I have included a list of them on this slide. A tragedy of the work that we do is that we build massive, beautiful infrastructure and immediately we bury them under the soil so no one can see them. But we do a lot of this kind of work, and in this case, it's not going to be any different than that. Next one, please. With that being said, taking care of the stop part and the accept part, there's a new third category of actions that we are introducing for the program that we call it INI prevention, meaning that we want to learn from every experience that we have, every fix that we do today, and we want to integrate that into everything that we do to make sure that 50 years down the road from now, we don't have to go back and fix the same issue again. An example would be the lateral issues that I mentioned. Today, it's really costly and disruptive for us to go and do that. But for a brand new development that is happening right now, a new subdivision that is getting built right now, we could address that issue for probably no cost and make sure that 50 years down the road, when I'm not here and someone's sitting in my chair, don't have to do that. Next slide, please. However, dealing with these kind of issues, prevention opens the door to a lot of interjurisdictional issues and make it difficult. However, we are not afraid of that. We work with our partners. Some of them are listed here on daily basis, on regular basis, and we will tackle these problems as well. A list of some of the examples of collaborative work that we do with the lower tier municipalities and the conservation authorities are listed here, but the list goes on and on. I wish I could get into more details with that. Next one, please. With that, thank you very much. I'll pass it on to Anthony.
Thanks, Farshad. If I could have the next slide, please. So over the next 5 to 10 years, our staff are prioritizing our work based on tackling areas with the highest INI levels. Our work within the priority blocks will be continuous. We are currently ahead of schedule for the first 3 blocks, those that are shown are in red on this map. The map shows the additional 6 blocks that we'll be working on over the next few years in terms of their priority. Orange next up in our program, and yellow to follow after that. This is not the limit of our rehabilitation work on our sanitary sewer system here in Peel. Our staff are continuously working on assessment and rehabilitation projects in accordance with our State of Good Repair Plan region-wide. Next slide, please. So Peel's water and wastewater staff continue to advance industry-leading programs designed to benefit our community. Our gauge-adjusted radar rainfall program is one of our programs which we informed Council about in 2019. This program is now ongoing and uses real-time radar data and storm prediction models to calculate rainfall amounts region-wide before storms even occur. As an example of this is the picture in the top right side of the slide, and you can see the rainfall occurring over the region of Peel in this model. When we couple rainfall information with our real-time flow monitoring data in our sewer system and our hydraulic models, our staff can develop systems to predict actual flows in the sanitary sewers and then calculate where sanitary systems will not be able to accommodate that flow. Furthermore, our staff are developing real-time control systems that will allow us to divert wastewater flows from high flow areas to areas which have the available capacity. Our plan is to automate this, thus becoming a real example of artificial intelligence for wastewater collection systems. We are also sharing our rainfall data from this program with our external partners, including the conservation authorities, who leverage real-time rainfall data for flood predictions. Integrating all this data into our GIS-based information systems allows us to respond to customer inquiries and track performance metrics in our system. This also generates high level of information that we can share with our residents and businesses on an as-needed basis. Our wastewater system is clearly far more than just pipes in the ground. Next slide, please. So our work did not stop during the pandemic. Our I&I and engineering teams continued major projects in 2020, and this is but one example we wanted to share with Council. In 2020, our teams completed the rehabilitation of a major trunk sewer in Brampton where we found significant early degradation. The picture on the left shows pre-construction condition, and the picture on the right is our completed work, the exact same location. Our staff is continuing to assess and complete major rehabilitation projects region-wide. We are pursuing significant funding opportunities for our rehabilitation and I&I remediation projects, and we hope to bring some real success stories to Council this year. Next slide, please. I want to thank Council for your time today. We'll leave you with one more picture of a major sanitary sewer project shown in the picture here. One with an innovative construction and lining project which protects the pipe from early degradation and ensures long asset life. Our water and wastewater staff remain committed to programs to ensure our assets will serve our communities for the years to come. Thank you for your time.
Thank you. And Farshad, thank you very much. I know it's water and wastewater, and most people don't get excited about it, but you folks do. And that's a great presentation, one of the best that I've seen in 33 years, Farshad. Well done on, as I say, a somewhat mundane item to others. So good for you. With that, I have a couple of questioners, Councillors Grove and Raz. Councillor Groves.
Thank you, Mr. Chair. And I get excited about water and wastewater and I&I. And Anthony, I want to thank you for actually educating us over the years about I&I and the importance of preventing this sort of stuff, because many of us are focused on building new infrastructure, but we forget about what's in the ground and what's happening in there. And certainly we don't want our residents having sewer backup and things like that. So I guess that just reinforces the need to focus on infrastructure that's already in the ground. Very glad to hear that you're looking also on prevention, because I think that that's the at the end of the day, Farshad, that you said, you know, you'll be here 50 years from now when someone else is in your seat, you know, they don't have to worry about this. So I think always the prevention piece will save us a whole lot of money in the long run. So thank you for being forward thinking and great technology that you have in, you know, looking at the conditions of these sewer pipes and that. So that's great. And it's good to see that you're also cognizant of the whole climate change. We're having heavier rainfalls, we're having more frequent storms. And so that, I guess, leaves room for that additional rainfall to discharge into our sewer system. So I am so happy that you're so well versed in this, and you're going to save us a ton of money. So I just have a couple of questions through you, Mr. Chair. So Anthony, how many of how many do we have in total of these sewer pipes that need repair throughout the region? Because I don't think I saw a total on your chart.
Through the chair, thank you for the question, Councillor. As our programs evolve, we do yearly rehabilitation or assessment projects based on criticality. A number of years ago, we actually did a very detailed risk assessment, and we used that risk assessment to determine which infrastructure we should investigate first. And our teams do that investigation on a yearly basis based on prioritizing that work. And where we find, of course, evidence of degradation, we build it into our capital program. So we don't have a set amount or linear distance. We have almost 4,000 kilometers of wastewater pipeline in the region system, so there certainly is a lot of work to do. We do inspect local pipelines, the smaller pipelines, up to about half meter in diameter. We inspect over 400 kilometers of that every year with our own internal team. So through both those programs, the large work and the small work, we're able to pinpoint how much work we actually, or how much rehabilitation program work we need to do on a year basis.
Okay, that's great. Thank you. And just finally, Anthony, just a real thank you from myself and my community to you and your staff in water and wastewater. We really don't realize how important what an important role you and your team play in our quality of life and how important water and wastewater is to us. So thank you so very much. And also just for being forward thinking. Anthony, you have saved us a ton of money over the years. You come to us with savings wherever you can find them. And I certainly would like to commend you and your team on that. So please take my thanks back to your team. And again, just, I don't think I'd want to be in your shoe right now because, as we know, we have a significant shortfall in infrastructure dollars, and it's a very challenging time right now. So, but you have done a remarkable job in managing this and really keeping Peel Region #1. So, thank you very much.
Thanks,
Councillor.
Well said. Councillor Raz.
Thank you very much, through you, Mr. Chair, and I would just like to echo Councillor Grove's kind comments. I love the passion from both of you, especially Farshad, who did a fantastic job with the presentation. I'm excited about infiltration again, so thank you for that. It's nice diversion from COVID. A few questions on the presentation itself. So the study that's going to be looking at the other 75%, do you have a sense already of whether it's primarily residential or C&I?
Through the chair, I'm actually going to ask Farshad if he has a good idea. Maybe he can answer that question for us.
Sure. Yes. Thank you to you, Councillor Ross, and everyone else for the nice words. Certainly appreciated. The answer to your question, this is a matter of case-specific stuff, and well, it's great that you're asking the question because Park Royal is part of your jurisdiction, and we are actually doing work right in there. It's been a problematic neighborhood for years, and we are hoping to put an end to those days. The solution is going to be a combination of conveyance, storage, most likely within the right-of-way. So we are looking at a host of solutions to see what is best and what's going to give us the biggest bang for the buck. Right now, just recently, we kicked off the study for Block 1, which encompasses Park Royal, and we would very much like to come to you and discuss some of the solutions as we come up with it, but you may anticipate that there will be a combination of storage, whether it's in the form of bigger tanks or bigger pipes within the right-of-way, as well as maybe upsizing some of the pipes or twinning them to provide additional capacity. Because we've already taken care of what we could stop from getting in. Now we just got to make sure those that are eventually going to make their way into the system are not causing any trouble.
Okay, thank you for that. And yes, I noticed in the map I either have red zones or hot zones, or sorry, orange zones, and maybe just a little bit of green, but I'm in a fairly older area of the city. How does low impact development feature into your future plans? Because, building more pipes and more storage tanks is one thing, but especially on private property to do that additional water capture on site without releasing it into the system in the first place is probably something we would want to aspire to.
Through the chair, Councillor, LID, great point on LID. Certainly, any quantitative or qualitative control of stormwater always helps us on the wastewater side, right? If we control it, the challenge we have, of course, is as it finds its way into defects and maintenance holes and the likes, we may not get the direct benefit perhaps from stormwater controls as we'd like. The challenge often comes from degradation. It comes from flooding in our river valleys. A lot of our major infrastructure was designed where we could leverage gravity, and that means it's sitting in river valleys, and it's really susceptible to flooding, ice damage. We've spent an incredible amount of time inspecting those critical assets. So stormwater control has an impact on our work, but not as much as we'd like to. We still have to chase all that related work in where our critical infrastructure sits. That's usually susceptible to those criteria. I hope that helps.
Yeah, no, that makes sense. Last question. So we recently had our eaves trough done, and we have rain barrels, and the guys did the work, and I'm working here all day, and I go back outside, and they reconnected things to the downspouts. And so I had to go in and reconnect to the barrels. But there needs to be some type of education component with these companies that do the work. And they also have I think, an obligation to let the homeowners know about what the opportunities are for downspout connections. And certainly we shouldn't be encouraging reconnections, especially when they take it away from a rain barrel. But anyways, it's neither here nor there. But I do think there needs to be education for those companies. And I know there's not a close association that they would typically belong to, but something to consider about how we can reach that group.
Through the chair, great point, Councillor. We will see what we can do. We're also working with the city directly on a number of their programs on the stormwater side as well, so we can have that consistent message to residents as well. Of course, downspout disconnection has lots of issues with icing on private property. So Farshad's team has done a great job in planning out that disconnection so we don't add health and safety related matters as well. But yeah, great point. We'll take it under advisement there and see what we can do with that one.
Perfect. Thank you both.
Thank you. Councillor Dasko.
Thank you through the chair. As Anthony knows, I always enjoy hearing his reports, the passion, and now I've got to say, Farshad, again, great presentation as well. It's I think you've converted me into being a sewage treatment type geek on all this stuff because I find it just really, really interesting. My one question I do have is with regards to the Hague Boulevard storage. And that's the sanitary sewer into sanitary storage device. Where is that exactly going to be placed? Because I know that we had some conversations a little while ago about this with regards to the potential defunct hydro corridor and off that. So I want to make sure that this is not, in fact, the same thing.
Through the chair, thanks for the question, Councillor. It's a wonderful question. Of course, that was a project on our radar. And we did a very deep study into the Hague storage device. Hague, for everybody's information, is one of those bad news infrastructure where you had a major trunk sewer and then you had individual residents connected to this trunk sewer. So of course, when the sewer surcharged, boom, we were in people's basements. We did a diversion to get flow away from Hague. We wanted to turn it into a storage device. Of course, why not use infrastructure if it's derelict there? We've actually relocated that now to the Etobicoke Creek, where we've actually made an application to the government for a major funding initiative. And that was one of these projects that I hope to bring good news story to council soon. But Councillor Dasko, that's what we're doing with that. We're trying to leverage, of course, old or derelict infrastructure or otherwise suitable locations where we can store, as Farshad said, that extraneous flow or surcharging that happens in our system during these major events. Rather than put it in people's basements, I want to put it in pipe. Right? So we're working. We're going to bring you an update on that very shortly, but I think we're going to move it away from Hague because some of the constraints we have right now.
Yeah, because I believe last we talked, and that's why that caught my eye, because I know we were talking about an area just off Dundas where it wouldn't be in a residential community. So I'm hoping that is still the case.
Through the chair, Councillor, that is exactly the case.
Okay. Thank you, sir. Very much appreciated.
Okay.
Half of the local residents is they really thank you as well.
Okay, thank you. Well done, gentlemen. Great presentation. I have receipt moved by Councillor Grove, seconded by Councillor Raz. Anybody opposed? That is carried. Thank you. Thanks again, gentlemen. Okay, that brings us to about 15 after 12. We have about 10 items left that were held on consent, and we need to give the Home Office folks a bit of a break. So why don't we call a recess till 12:45 when I expect you back so we can deal with the last handful of items. So see you back at 12:45. Thank you. We are back in session. We've dealt with all of the presentations and deputations. First up on our consent agenda, items related to planning and growth management. Item 11.1 asked to be held by Councillor Parrish, Peel's Growth Management Program and Development Charge Performance. Councillor Parrish?
Yes, thank you, Chair Unica. This was one of the reports we didn't get to at our planning meeting, but the whole group thought it would be important to share with all of council rather than just keep it as part of our committee. It goes into the $319 million shortfall on DC funds. When you go into page 4 and 5, I have a question of staff if they're here. Under 3 growth monitoring findings and analysis, it suggests that the pandemic has elevated the risks as uncertainty around growth and development within the region. And it says it has not been as severe as first predicted, while non-residential development has also met forecasted growth and exceeded historical averages. But on the next page, it says, Peel remains at risk of not meeting the council-endorsed non-residential growth forecast 10-year growth. From 2016 to 2020, building permits issued for approximately 39% of 10-year non-residential space forecasts. So I don't know which is accurate or if I'm misreading it, but it seems to say on one that we're doing fine, and then on the next one it says we're not meeting our forecast. So could somebody explain that to me?
Through the chair, it's Keely Dedman. I can start by saying the second part that you had read, Councillor Parrish, is correct. We are meeting our growth forecasts with respect to the residential. However, we are not with respect to the non-residential. If you have specific questions related to that, I know that we also have Adrian Smith, our chief planner, on the line.
And I apologize for not sending my questions in advance. I always do. But I misplaced the binder. I think I don't know where I put it from our meeting, and I had a series of questions in there, and I'm kind of sorry we didn't get to this report. One of the things we talked about at Mississauga Council the other day was that they're going to try to issue more permits or restrictions in city center to get more office space. In this report, it says office vacancy rates are expected to rise due to increased work from home, but may be offset by in the longer term by continued shifts in employment to more service and knowledge-driven industries. And that's one of the things I would like to see, and I know it's a local planning issue, is for us to go for knowledge-driven industries rather than more warehousing and more logistics. So I'm just wondering if this meshes with your report, and maybe we should be bringing this back to Mississauga Council if they're going to restrict some of the building in downtown Mississauga to office space. We may be shooting in the wrong direction on this. I don't really need you to comment on it. I just wanted to point that out. And there was one of the things I wanted to ask, and I think I asked Janice Baker this a couple of months ago, if we could get a report that on developer paid infrastructure. A lot of them are offering to get quicker permits if they can pay, put in the infrastructure and pay for it, and then have DC credits. I don't know if you have an opinion on that, but I know in the past in Mississauga, Janice hasn't been a big fan of it, and I'd really like a report on that.
And she's come up on our list, so perhaps the CAO has a response to that. Carolyn, CAO Baker?
Yes, so I think we actually did at one point bring back sort of a higher level report, Councillor Parrish, on that issue of I think what you're referring to is the front end loading where developers can pay up front. So I think what we said in the report is that there is a place for that, but it does carry some risks with it depending on the length of time that it takes for the full development to happen and then recoveries to happen. So it is a tool. We actually do have already a policy at the region that allows for and speaks to the front end loading piece. So if you want, we can recirculate that report and the policy to planning committee. I think might be a good place to have that conversation. I think in respect, I did want to comment just on your first question, because I think you said which one is right, and I think actually both are true. In the longer term, we know that there will be challenges meeting, because we've seen those challenges continue to arise in meeting our development charge forecasts. I think though a year ago when the pandemic first hit, we were very concerned about our ability to meet even the lower revenue targets that had been established. And so, to the extent that we have a gap, we thought that gap was going to be significantly larger, but actually the pandemic response was not as negative as we expected. So the inherent gap in the development charge system does still exist, as Keely has noted. However, the pandemic impact was not as great as we anticipated it might be. So, we at least are not carrying over a huge gap, additional gap as a consequence of the pandemic, if that helps.
It does. It helps a lot. I just want to tell you, Adrian, and Keely, and you, Madam City Manager, the regional manager, that committee works really well. Our only problem there is we run out of time. We always book 2 hours, and I think the first 2 meetings went 3 hours thanks to the good graces of the staff. And then this last one, we cut it off at a half hour over. So it's really a good place to ask lots of detailed questions, and we're getting really good information from staff and really good reports. And I know Councillor Dasco and Councillor Sinclair come out regularly. Everybody's welcome to join us, but these are the sorts of reports every once in a while. I didn't want to just let it go. I thought it should come to council, and I would like to have that report recirculated. I would appreciate that. Thank you very much, and thank you, Mr. Chair. That's all my questions.
Thank you, Carolyn. And let me reiterate, it is a great committee, and the depth and the breadth of what we're dealing with and have to deal with. It's why you have committees and deal with these items, and there's so many more coming down. So well done to you, Carolyn, and the committee. I need receipt of the report, moved by Councillor Parrish, seconded by Councillor Sato, who I see. Anybody opposed? That is carried. Thank you. Next up, items related to enterprise programs and services. Asked to be held 13-1, 2020 Operating Financial Triennial Performance Report from Councillor Raz. Councillor Raz.
Thank you, through you, Mr. Chair. Just a quick question. So we had Safe Restart funding in the, approximately 16 million or thereabouts. And we had a $19 million surplus. What do you think the province's view is going to be? And I know that we could have surpluses, it's only around 1.2%, but I just worry about the optics of having a surplus with respect to Safe Restart funding.
Through you, Mr. Chair. So staff have worked closely with the province to make sure we apply the funding correctly as best they have defined it. So there is some still, it's yet to be tested if they're going to come back and audit or things like that. So I think we've made some good assumptions, and so we don't really have any concern about this. I do understand the headline, but when you read and I know you've read the report, when you read the report, it really does explain that it's really to offset the COVID costs, and it does point out the 161 million of costs really have been offset by a $95 million service level reduction. So the Region Appeal has helped itself prior to dipping into those other funds. So It's a risk, but we feel confident that we have applied the rules as they have defined them.
Okay, perfect. That's all I needed. Thank you very much.
Thank you. I need a recorded vote. So the matter was moved by Councillor Raz, seconded by Councillor Mahoney. Madam Clerk, recorded vote over to you.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor?
Yes.
Councillor Demerla? Councillor Demerla in favor. Councillor Dasco?
Yes. Yes.
I don't know if you can hear me. Yeah.
We heard down Councillor Dasco in the affirmative. Yes.
Okay, it looks like
Okay, I heard Councillor Downey.
Sorry, Councillor
In
Dillon
favor.
here. Can you hear me? I'm a yes for me.
I can hear you now. Actually, what I'm going to do is I'm going to switch over to my phone. So just one moment. Okay. Can you hear me now? Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, thank you.
Councillor Mahoney in favor. Councillor McFadden? Councillor
Yes.
McFadden? Councillor McFadden in favor.
Yes, in favor.
Medeiros
Yes.
in favor. Councillor Palashi?
In
Councillor Palashi in favor. Councillor Thank you. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
In favor.
Councillor Starr in favor. Councillor Early?
In favor.
Councillor Early in favor. And Councillor Vicente?
Yes, in favor.
Councillor Vicente, and that's unanimous and it carries. Thank you.
Thank you. Takes us to 13.2, 2020 capital performance and impact on capital reserves and reserve funds, asked to be held by Councillor Dasco.
Thank you through the chair. And I just had a quick question. I mean, overall, the report is pretty thorough. Just, of course, I've got some questions still that are lingering with regards to East Avenue, which is the project number 175033. And I'm just wondering, all the funds in here that are being spoken of, are those all? How much of this is actually regional funds, and how much of this is from the feds or the province?
Councillor Dasco, through you, Mr. Chair, I certainly do not have those details in front of me. Now, as it's my first meeting, I'm allowed to phone a friend, so Norm Lum is on the phone. And maybe if Norm knows, he can answer it. Otherwise, we can certainly get back.
That's great. A solid show and a solid question. Thanks.
Norm, can you help us?
Hi, through the chair, Councillor Dasco, just to be clear, are you asking about the breakdown of the funding for East Avenue?
Yeah, I'm just looking at the gross revised budget, the gross remaining budget. We've got the numbers here, the overall amount, etc. I'm just wondering, from a breakdown point of view, I mean, are all of these funds we're getting from higher levels of government, or are we also getting funds here from the region? Funds for the capital project.
Okay, thank you for the clarification. So through the chair, I actually don't have that level of detail. I think Janice is on the on the line, though, and she would know exactly what the funding breakdown for East Avenue project.
And the CAO has just come on my list, Ms. Baker.
Yeah, Norm has just said Janice Sheehy would have that information, or Aileen Baird for sure. And I do have it in an email, but it would take me a couple of minutes to go back and find it as a consequence, as you know, of a meeting that we had with Councillor Daskal about a couple of weeks ago. So maybe if Janice can jump in, but in the meantime, I will look for that in my email information.
Yes, thank you. And through the chair, I'm sorry, I don't have it at my fingertips either, but I can certainly follow up. I do know that there is a regional reserve contribution that is going towards the East Avenue project, so I can follow up with an email for you, Councillor Daskal.
Okay, thank you very much, Janice and Janice. And welcome, Gary.
Thank you, Councillor Daskal. Well, even sometimes phone a friend doesn't work, so we'll get that to you. Thank you.
Thank you so much.
Okay, if I have no other questions.
That's all. I'd be happy to move the report.
Thank you very much. And seconded, I saw Councillor Fonseca. If she'd be willing to second it, I need a recorded vote. Pardon me, Madam Clerk, over to you.
Thank you, Mr. Chair, and I'll begin with Mayor Brown. Mayor Brown? Mayor Brown?
Mayor Brown, are you prepared to vote?
Okay, we'll move on to Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie? Mayor Crombie? Councillor Demorla?
Yes.
Councillor Demorla in favor. Councillor Daskal?
Yes.
Councillor Daskal in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
In favor.
Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, thank you.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Sinclair in favor. Councillor Starr?
In favor.
Starr in favor. Councillor Early?
In favor.
Early in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. And I'll just circle back to Mayor Brown and Mayor Crombie. The motion carries. Thank you.
Thank you. 14.1, Ministry of Municipal Affairs and Housing. The information regarding a 90-day public consultation on how to strengthen municipal codes of conduct as asked to be held by Councillors Raz and Parrish. Councillor Raz.
Thank you, Mr. Chair. And I just want to make sure that my fellow councillors know that they have an opportunity to do the survey. It takes about 15 minutes. This isn't going to be driven by staff. It's going to be driven by, municipal councillors and others. So if you want to have your say about the future of our codes of conduct with respect to the province, I would encourage you to fill them out. That's it. Thank you.
Thank you, Councillor Parrish.
Yes, and I wanted to point out that registration for a council representative had to take place before this meeting, and you graciously agreed to represent our council as you do as head of the board, and will be representing us at the roundtable. And I was also going to encourage everybody to fill out the questionnaire personally. Those will all be counted. And I think we're in a really good position in that we have a good, fresh code of conduct that we just reviewed, and it's in pretty good shape. So we should make sure that we participate in this and share our smartness with other people. And thanks, Karen. That was good.
Thank you. As moved by Councillors Raz and Parrish, anybody in opposition? If not, that is carried. Takes us to 14.2. Letter from Minister Clark regarding the municipal code consultations. Councillor Parrish, you asked for this to be held as well.
Same issue, Chair Yanika. That was just referring to the fact that you're representing us.
Yes. Very good. And they've reconfirmed that I'm on the docket for that on May 18th. Yes. Madam Clerk, just a receipt for that? Madam Clerk, is that just a motion of receipt from Councillors Parrish and Raz?
Yes, it is.
That is correct. Thank
Is there
you.
anybody in opposition? If not, that carries. Takes us to 14.4. Message from Angela Suri on behalf of the Police Services Board. Copy of Police Services Board report regarding illicit cannabis in Peel Region. Councillor Raz.
No, thank you very much, Mr. Chair. And I'm not too sure who my question would be to. I do appreciate that this matter went before Police Services Board. I don't know if anybody from Police Services Board can speak to it, but I guess it stems from the comments that Chief Nish made during our budgeting session with respect to the challenges that they face with respect to, enforcement isn't around the legal shops, it's around the illegal shops. So I'm very appreciative of this report. I don't know if Dr. Lowe is still here, that maybe he can speak to it from a public health perspective, but I know he's probably more pressed. We can likely ask him at a later date. But I would ask that this correspondence be sent to the City of Mississauga and I guess Caledon as well, who they have not recently looked at the opting in of the cannabis file. So I'd be happy to move that, Mr. Chair.
Thank you. And Dr. Lowe is still with us and perhaps can respond. Lawrence.
Thank you.
So through the chair to Councillor Raz, I'm sorry, I didn't quite catch the question, but I heard my name mentioned while I was in the midst of navigating some other business. So if you could reiterate the question for me, please, I'm sorry.
Well, I guess based on what the police are witnessing, are we, from a public health perspective, are we seeing any greater detrimental impacts, or about the same, or with respect to the public health on the cannabis file now that it's been, what, 3 years, 2.5 years since it's been legalized?
Yeah, so through the chair to Councillor Raz, across the board, there has been an increased use of substances throughout the course of the pandemic, both legal and illegal. And so certainly that would be reflected, I believe, in cannabis smoking rates, both initiation amongst youth, as well as in respect of actual use increasing, just in reflecting the nature of just an overall perturbation of mental health and well-being during the course of the pandemic.
Okay, perfect. Thank you very much.
Thank you. With that, moved by Councillor Raz, seconded by Councillor Starr. Here for receipt. Any objectors? Hearing none, that carries. Next up, I'm on to items related to public works. First, 15.2, increase to contract 2017-395N for biofilter media replacement at the Peel Integrated Waste Management Facility as held by Councillor Starr. Ron.
Yeah, I have some general questions on this, and I'm not sure. The first one is, how long has BioRem been working for the region, or at least supplying equipment?
Through to staff.
Through the chair, I am just checking on that information. We do have a long-term contract with BioRem that goes back at least 5 years at this point, and it did include the extension for the replacement of this biofilter in that contract. We just didn't know what the price was at this time because we didn't know when it would be required, and that's why it's coming back to council with the cost at this time.
Okay, one of the reasons for this, and maybe I'm going to suggest something here, when there's a large contract of something like this nature, maybe it should have gone to waste management. And I've had a couple of questions asked of me once they saw it on the agenda, and I'm just going to go through them. What new systems are available? Because from what I gathered, we've been working with this system for 15 or 20 years. Is this right?
Sorry, through the chair. I don't have those numbers in front of me at this time. I have asked staff for that, and I can certainly respond to you. But it has been a long-term contract with this provider, and we did know that the medium would be required to be replaced at some point in time along now. That being said, there's opportunities in the future as the system continues to degrade for us to look at alternative solutions. I would just add on to that this piece was included in the waste management strategic plan for maintenance. So it had been identified and it had been part of our longer term plan.
Okay, but the regulatory regulations for the province of Ontario have been in place for this type of media for a long, long time. And I'm just wondering how we've evaluated a single source for this. I mean, maybe in the grand scheme of things, it's not a lot of money, but $600,000 or $700,000 for media replacement, where you have no other source. Who came up with the specifications? BioRem or?
Through the chair, there was a procurement process that was undertaken originally to retain this particular technology. And as we continue to go forward and update the strategic plan for waste management, we would certainly look to other technologies that might be available.
Okay. Keely, maybe I'm going to make a suggestion because a couple of the questions came from members of the committee on this one. Can we have a meeting, waste management next week, right? I'm just wondering, this is not critical. You don't need it today or tomorrow. Can we send this back for information, at least to waste management next week? And then I think you'll also satisfy a couple of the other members' queries, and rather than waste time this afternoon. And Chair, I'd like to suggest that we just refer it back to waste management.
And Ron, I would concur. The chair's also received some inquiries on it, and I think it would be very appropriate to go back to, and the timing's in our favor. It's next week, and it'll be back at our next council.
Yeah.
Keely, is there any reason that would be a problem?
To you, Mr. Chair, no, that is perfectly fine.
Very good. So the motion is one of referral back to committee, as moved by Councillor Starr, seconded by Councillor Mahoney. Anybody opposed to that? All those in favor? Thank you. Okay, moving on, Councillor Starr, 15.3, request to amend the agreement for contingency waste disposal services with Emerald Energy from Waste Inc. Ron?
Yeah, this one here is another one that it's been ongoing for a long, long time. And I think the committee needs to take a look at this because it was with Emerald. Emerald was a long-time supplier for many years. And I'm not sure if that's the right amount that we need to have in the contract. I think I understand it, but I think we could probably get some quick answers if we referred that back next week also. Just to clarify some of the issues, the timing, and how many tonnes of garbage that we're working with. So rather than discuss a lot of this here, Keely, I think it'd be probably worthwhile to just send it back and get some answers. And in the meantime, I think myself and the vice chair, maybe we can chat with you and get those answers ahead of time.
Keely, does that cause us any distress? Can we live with the 2 weeks?
No concerns.
Very good. So the motion again from Councillor Starr, seconded by Councillor Mahoney, is that it be referred to committee next week and to come back. Anybody opposed to that? That too carries. Okay, moving on. Thank you, Ron. I'm moving on to item now 15.4, paid duty police coordination services for construction as held by Councillor Raz.
Thank you, Mr. Chair, and through you, I'm not too sure who the question should go to. When it comes to the coordination services, is that all in, or is that the amount that goes direct to the Mark Marple Enterprises? And is there additional funds for the paid duty officers on top of that that comes out of the capital budgets for the projects? I was unclear about that.
Keely, can you answer that for us, Keely?
I can, yes. That is the cost for the officers to be on site for the work that they are providing. So there's no additional costs in terms of the on-site work.
Okay, thank you. And I do note that it has entering into this type of contract has resulted in cost avoidance of what 1.7 million over 3 years, which is good. So I know that this is an efficient way to do it, but I was just wondering if there was additional costs for the hours or if it was just for the company itself. So thank you very much. Happy
Thank you,
Mr. Chair.
Thank you. I have no other questioners. I need a recorded vote as moved by Councillor Raz and seconded by Councillor McFadden. Madam Clerk, recorded vote over to you.
Thank you, Mr. Chair, and I'll begin with Mayor Brown.
Yes.
Mayor Brown in favor. Councillor Carlson.
Yes.
Councillor Carlson in favor. Mayor Crombie.
Yes.
Mayor Crombie in favor. Councillor Jamarla.
Yes.
Councillor Jamarla in favor. Councillor Dasco.
Yes.
Councillor Dasco in favor. Councillor Dillon.
Yes.
Councillor Dillon in favor. Councillor Downey.
In favor.
Councillor Downey in favor. Councillor Fonseca.
Yes.
Councillor Fonseca in favor. Councillor Fortini.
Yes, in favor.
Councillor Fortini in favor. Councillor Groves.
Yes.
Councillor Groves in favor. Councillor Innes.
In favor.
Councillor Innes in favor. Councillor Kovac.
Yes.
Councillor Kovac in favor. Councillor Mahoney.
Yes, thank you.
Councillor Mahoney in favor. Councillor McFadden.
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros.
Yes.
Councillor Medeiros in favor. Councillor Palashi.
In favor.
Councillor Palashi in favor. Councillor Parrish.
Yes.
Councillor Parrish in favor. Councillor Raz.
Yes.
Councillor Raz in favor. Councillor Sato.
Yes.
Councillor Sato in favor. Councillor Santos.
Yes.
Councillor Santos in favor. Councillor Sinclair.
In favor.
Councillor Sinclair in favor. Councillor Starr.
In favor.
Councillor Starr in favor. Councillor Early.
In favor.
Councillor Early in favor. And Councillor Vicente.
Yes.
Councillor Vicente in favor. And that's unanimous and it carries. Thank you.
Thank you. On to 16.3, which requires direction. This is from Deb Martin Downs Credit Valley Source Protection Authority, requiring and requesting a joint nomination of one Region Appeal representative to the Credit Valley, Toronto and Region Central Lake Ontario Source Protection Committee. Do I have a nominee, Madam Clerk? And I see a list. I'll go to my list. My list is Raz and Paleshi. Councillor Raz.
Thank you very much, Mr. Chair. And I know that Andrew Farr was the previous representative, so it's typically at the staff level. I'm happy to, look forward to some names. I know that I don't know if a sitting board member on CVC can be part of that, but it's typically a staff member. I'm not too sure if there's a thought about any names being put forward from the region?
A good question. It's pending. I'm going to go to Councillor Paleshi, then I'm going to ask staff for their thoughts on your point. Councillor Paleshi.
Same comments as Councillor Raz, and just so everybody knows, the City of Brampton got the same correspondence and asking for us to put somebody forward, but I know it's typically at the region. We support, the City of Brampton supports anybody that the region's putting forward.
Thank you. Councillor Sinclair.
Yes, thank you. I noticed Andrew was the last representative. However, if there's no staff member, I would put my name in the ring for consideration.
Okay, thank you. That's noted as well.
That's it.
Commissioner
I don't know what the
Keeley,
process is.
and I'm going to inquire on that same thing. Commissioner Keeley, can you shed some light on this?
Yes, thank you, Mr. Chair. It previously was held by a staff person, and staff are recommending again that continues to be the case. In the motion before council that relates to this item, we are in fact recommending the Director of Water Wastewater. the position itself, not necessarily the person.
Okay, so that would be the logical course. So that's the recommendation from staff. Councillor Ras, I come back to you, and Councillor Paleshi, would you move such a motion?
I know that Councillor Sinclair put his name forward. There are skills and qualifications that they're looking for. Maybe he can take a look at that and see if he would fit. I don't know much about his background, so if those skills fit, he can take a look at that.
So can the chair make a suggestion?
Till the end of the meeting?
Or I was going to suggest, I don't think 2 weeks changes the universe. Good on Councillor Sinclair to step up. Maybe we can address some of these questions offline. And if appropriate, wonderful to have an elected official, if that's proper, assuming if we look at their composition and they have other ones, you would think it's okay. If they don't, we'll deal with that then. But through to the commissioner, if this were to be held for 2 weeks' time, that we can address some of these matters. I'm trusting that won't change the world.
Yeah, it's the end of, we need to provide a name by end of June.
Okay, so there you have it. So why don't we refer this back for that analysis and understanding so that it can come back with a nominee in 2 weeks' time. Okay, Councillor Ras and Paleshi, that is the direction that it be referred back. That is my motion. Do I have any other speakers to that?
Chair, sorry, this is a brief. I wonder if we could just treat this as a deferral motion to be deferred into the next regional council meeting.
Yes, through to the clerk, how do you think most appropriate to move it on for 2 weeks?
I would say we defer it to the next council meeting, which is May the 27th.
So that was the motion. It was moved for deferral. Anybody opposed? That is carried. Okay, that takes me down to other business or inquiries from councillors. Just seeing if any hands go up. Here we are, Councillor Groves.
Thank you, Mr. Chair. I just wanted to recognize, I think this week is Public Works Week, celebration of Public Works Week. So I just want to say thank you to our staff in the Public Works Department and just recognize them for the great work that they continue to do for the region of Peel.
Okay, thank you. Any other business or inquiries from councillors? Seeing none, that brings us to notices of motion to be dealt with. I have three. The first is the motion regarding province-wide Vision Zero strategy. Councillor Sato, did you wish to speak to this?
No, I'm just moving it, Mr. Chair. It's pretty self-explanatory.
Very good. Madam Clerk, am I dealing with this now or the next agenda?
We can deal with it now. We just need a seconder to the motion.
Who will second the motion for me? And I don't see anybody other than myself. Oh, very good. I didn't. Who was that?
Paleshi. Councillor St. Clair. Okay.
Oh, okay. I heard Paleshi first. As moved by Councillor Sato, seconded by Councillor Paleshi. Madam Clerk, the vote over to you.
Thank you, Mr. Chair, and I'll begin with Mayor Brown. Mayor Brown? Councillor
Yes.
Carlson. Mayor Brown in favor. Thank you. Councillor Carlson?
Yes.
Councillor Carlson in favor. Mayor Crombie?
Yes.
Mayor Crombie in favor. Councillor Demurla? Councillor Demurla? Councillor Dasko?
Yes.
Councillor Dasko in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes.
Councillor Fonseca in favor. Councillor Fortini?
Yes.
Councillor Fortini in favor. Councillor Groves?
Yes.
Councillor Groves in favor. Councillor Innes?
In favor.
Councillor Innes in favor. Councillor Kovac?
Yes, in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes, thank you.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish?
Yes.
Councillor Parrish in favor. Councillor Raz?
Yes.
Councillor Raz in favor, Councillor Sato.
Yes.
Councillor Sato in favor, Councillor Santos.
Yes.
Councillor Santos in favor, Councillor Sinclair.
In favor.
Sinclair in favor, Councillor Starr.
In favor.
Starr in favor, Councillor Early.
In favor.
Early in favor, Councillor Vicente.
Yes.
Councillor Vicente in favor. And that carries. Thank you.
Thank you. Brings us to notice of motion 22-2, motion regarding emergency briefing from the Medical Officer of Health, as moved by Councillor Parrish. Councillor Parrish, did you wish to speak to this?
With your permission, I would withdraw the motion. You and I seem to have arrived, our stars aligned at the same moment in the same space. And I think it's already, I don't need the motion anymore. Thank you. I'll withdraw it.
And thank you. Very good. Moving on, notice of motion 22-3, a motion regarding provincial action on noisemakers. Councillor Dasco, did you wish to speak to your notice of motion?
Yes, through the chair. I would like to introduce this motion. I have heard from Councillor Sinclair that he would like to second this, and so I'd be more than welcome if he's still willing to do so. This is a very similar motion I brought forward and was seconded by Councillor Raz in the city of Mississauga. And this is further work that Councillor Raz has greatly done to try to combat some of these noise-making. Some call them Hollywood mufflers or bypass type things. This is what, quite frankly, I believe has been terrorizing our neighborhoods and our streets. And I don't believe that it's just to Ward 1 in Mississauga. However, some of my residents think it might be. I think it's much larger. It's a real pandemic on its own. And I do think that strong measures need to be taken, and they need to be done by example. And that's where I think the province needs to step in and take some action. We did have provincially, I think they were off to the right start, and that was with Bill 132, Better for People, Smarter for Business Act, that was brought in, which was going to amend Section 75.1 of the Highway Traffic Act with regards to tampering of motor vehicles and bypassing or defeating certain parts of their emissions. Sadly, I think part of what this would have done, it would have filled a gap that was left by the controversial, I guess, Drive Clean program. But one of the unintended consequences there is that mufflers like this, which probably would not have passed, we don't know, are left without any kind of oversight. So I would like to actually see that this bill that was passed actually be enacted and have some teeth to it. Also, with regards to this, speaking to our local police, they get very frustrated with this as well. They introduced Project Noisemaker and also, of course, have in place for a while Project Erase on the speeding component. But they said one thing that frustrates them to no end is the lack of real teeth that the current Highway Traffic Act has in terms of remedies. The tickets that get doled out right now are for about $150, and some of these folks have taken to social media and posed with the tickets as a badge of honor. And so that's why I also ask that we put forward to the province not only to have these types of aftermarket exhausts that are over the decibel range of 80 not allowed to be sold in the province of Ontario, but also that it comes with, for those people that are in violation, have a minimum of a $500 fine with 3 demerit points. And so I'd like to put this motion forward at this time, and that is essentially that you would put forward to the Minister of Transportation, all Peel members of provincial Parliament, the Association of Municipalities of Ontario, Peel Regional Police, and the OPP for their information and to see if they would see fit to have the province undertake this. So I'd like to bring that motion forward now, if I could.
Thank you very much, Councillor Daskal. Councillor Sinclair, you're next up, but I first have to ask you if you would second the motion so that it's
Yes,
duly
sir. I would
informed.
please to second the motion.
Very good. Please feel free to speak to it now if you wish.
Yeah, this is a Peel-wide issue here. And all the way from Bolton right through Caledon East and Caledon to Bellefontaine, Forks of Credit Road. And it's really become an issue, particularly for drivers coming out of big urban areas and acting out in Caledon. Street racing 2:30 in the morning up and down the Forks Road. And just a horrible din of noise. So it's an issue here. We've had a joint village delegation and presentation to Town of Caledon Council on noise from traffic. And so I fully endorse this. This is an important livability issue for us. Thank you.
Thank you. The motion is duly before me. Speakers to the motion, Councillor Starr.
Yeah, I support the motion with one exception, and I spoke to it at the council meeting at the city of Mississauga. Did some research. What bothers me most is the fact that Councillor Daskal is asking in the motion at the bottom of 22.3.1 about demerit points. And if you research the Traffic Act, and which I did, by the way, and did speak to someone at PRP, the color of the car, the tinting of windows, the lowered springs, and all the rest of it, these can be, these are finable items. Demerit points was meant for driving, and that's very clear. And on principle, because this includes demerit points, I can't support the motion because I think it's a false hope that the province is going to take a look at something for noise, and it just bothers me that on principle we're looking to tack on, and that's what I think is happening. We're just tacking on whatever can make this even more onerous. I believe that fines, if we increase it to $500,000, that's the onerous part. And this badge of honor things, you know, young people will be young people, and I'll give you lots of examples of that. But that's the only thing that bothers me is asking for demerit points when you know that's in the Highway Traffic Act. That's not going to happen. So I can't support it just based on those 3 or 4 words. Thank you.
Thank you, Councillor Starr. Councillor Daskal.
Thank you through the chair, and I appreciate what Councillor Starr has said. He said also at Mississauga Council, but the reality is I do think that this is a road safety matter, and so I will stick with the motion as is. Thank you.
Thank you. Councillor Sato.
Thank you, Mr. Chair. Yes, we did discuss this at Mississauga when we passed it, and I think Peel Regional Police have said very clearly that in the majority of cases, actually in almost every single case where they have stopped one of the drivers with the noisy muffler, they have been also driving dangerously, carelessly, speeding, and they do go hand in hand. And that is information that we got from Peel Regional Police, and we have discussed at our Road Safety Committee as well. So it was interesting because after the results of the vote were sent out to the Road Safety Committee, 2 of the people on the committee have asked me, do councillors not give an explanation why they vote against this type of a motion? And I had to refresh my memory as to who voted against it and why. And, they felt as well that, they should be losing demerit points because it's not just noise. I mean, the noise and the speeding have been going hand in hand. There is proof of that from Peel Regional Police. And so I think it's very appropriate to keep it in the motion and to support it. And hopefully all regional council will. It also ties in, with, we just passed the motion on the Vision Zero strategy to ask the province to establish a province-wide strategy. And this is so much a part of Vision Zero is the anti-speeding and getting these cars off the road. And if you ever I back onto a onto a main road in Mississauga. And I hear them all the time, day and night. And they are definitely not going 50 on 10th line when it's not just the noise that makes them sound faster. They are definitely going a heck of a lot faster on 10th line. So I can attest to it from, looking out my upstairs windows and seeing them. Well, it's hard to see them because they go by so quickly, but yeah, it's not good. And we have it, Councillor Mahoney and I and Councillor McFadden, we have it on Winston Churchill. And and Gary, you live in that area. You've probably seen it yourself. It's really, really dangerous. So let's hit them with demerit points.
Thank you, Councillor Parrish.
Listen to good old Uncle Ron at Mississauga Council, and he made sense, and he still makes sense. But then I had a couple of other people say to me that they've almost had accidents because when a car making that much noise goes by, they're distracted when they're driving. And I found that the same thing with motorcycles. When they go zooming by you, you kind of you turn, you may turn your wheels. So I'm going to support it this time. I have no confidence that this government's going to do it, and once you put the complexity of points in there, it's going to be a 3-year debate down at Queen's Park. It might have been easier to get it passed just as a finable offense, but I have been convinced that it is also dangerous. Thank you.
Thank you, Councillor Parrish. Last call for any speakers. Councillor Parrish just came on and off again. We're good. If there are no other speakers, the recorded vote over to the clerk.
Thank you, Mr. Chair, and I'll begin with Mayor Brown. Mayor Brown? Councillor Carlson?
Yes, did you hear me? Yes.
Mayor Brown in favor, thank you. Councillor Carlson, I heard in favor as well, thank you. Mayor Crombie?
Yes.
Mayor Crombie in favor, Councillor Demerla? Councillor Demerla? Councillor Dasko?
Yes.
Councillor Dasko in favor, Councillor Dillon?
Yep.
Councillor Dillon in favor, Councillor Downey?
In favor.
Councillor Downey in favor, Councillor Fonseca?
Yes.
Councillor Fonseca in favor, Councillor Fortini?
Yes, absolutely.
Councillor Fortini in favor, Councillor Groves?
Yes.
Councillor Groves in favor, Councillor Innes? Councillor Innes? Councillor Kovac?
Support.
Councillor Kovac in favor, Councillor Mahoney?
Yes, thank you.
Councillor Mahoney in favor, Councillor McFadden?
Absolutely support.
Councillor McFadden in favor, Councillor Medeiros?
Yes.
Councillor Medeiros in favor, Councillor Palashi?
In favor.
Councillor Palashi in favor, Councillor Parrish?
Yes.
Councillor Parrish in favor, Councillor Rouse?
Yes, absolutely.
Councillor Rouse in favor, Councillor Sato?
Absolutely, yes.
Councillor Sato in favor. I know Councillor Santos indicated she had to leave at 1:30. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yeah, I'm looking forward to 3 or 4 years. Thank you. Yes.
Starr in favor. Thank you. Councillor Early?
Absolutely in favor.
Early in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. And the motion carries. Thank you.
Very good, Madam Clerk. That brings us down to the bylaws that I will turn over to you.
Need a mover and a seconder. I see Councillor Raz and Councillor McFadden. Thank you. That the bylaws listed on the May 13th, 2021 Regional Council agenda, being bylaws 31, 2021 to 33, 2021, inclusive, be given the required number of readings, taken as read, signed by the regional chair and the deputy regional clerk, and the corporate seal will be affixed thereto. Are there any objections? Hearing none, that carries. It takes us on to the confirming bylaw.
And there are no bylaws coming out of the in-camera, Madam Clerk?
Nope, just those bylaws that I just...
Very good. So we are on to the confirming bylaw as moved by Councillor McFadden, seconded by Councillor Mahoney. Is there anybody opposed? That is carried. Then a motion to adjourn from Councillor Sinclair and Councillor Starr. All those in favor? Any opposed? That carries. Well done to all and to staff today. Thank you very much. Enjoy a little bit of your afternoon. Thank you.
Thank you.